So Timbuktu, Ghana, Mali, Sumanguru, you know what you're shown. What where what you're shown. So Timbuktu, Ghana, Mali, Sumanguru, you know what you're shown. Manchester, you know Sumanguru, you know what where what you're shown.
This program is brought to you by World Remit, a fast, reliable and better way to send money.
World Remit helped me give you the best start in life, even if I couldn't be there to see it. I know it wasn't easy comparing yourself to your friends, but the money I sent home meant that you could be right there alongside them today. I'm so proud to be your mother, almost as proud as you must be now that you're starting an incredible new chapter.
Good evening and welcome to the Ghanaian Community Awareness Forum, the 12 in number. And welcome to our audience and our special guest for tonight. This is an authoritative news, information gathering, awareness, and education program. And so therefore, while I do so to welcome my guest, I would like to take your knowledge to make you aware and also make you aware that this is not a political platform. We are here to educate, inform, and become aware of the things that we have otherwise not been very conversant to in terms of what goes on with our protocols, myths, and testing at the Ghana's Kotoka International Airport. This evening, we have a special guest, someone who is very versed in what they do and have done so for several years. But before I bring him to light, I would like to set out a few ground rules. Some of you are used to it, but it's worth saying that audience will not be allowed to mute themselves throughout the program, except when it's time for question and answers. And also, if you can, where possible, try and show your face and let's see your name so that we know who we are engaging with when it comes to Q&A. In terms of questions and answers, please use the chat room and you can put a chat room question there and we will read it out. And if you want to speak it out loud, please do so using the Zoom icon and raise your hand. You will not have the permission to share any screen with us except the guest or the speaker tonight. And when it comes to Q&A, please do so, but please be mindful of others who want to ask a question as well. One question at a time, straight to the point, and I'm sure our special guest will do his best to give you the answers that we all deserve. And so tonight, I'm going to introduce to you a very fine man, a man who we have all come to know as a public figure in Ghana in terms of medical and for his services to the Ghanaian community in Ghana and elsewhere. He's currently the presidential advisor on health at the Office of the President of Ghana, having worked in leadership roles as medical superintendent at district hospitals, medical director at the regional hospitals, chief executive officer at the teaching hospitals, and director general of Ghana Health Service. He, in his work, has created a balance in strategic, operational, business, clinical, and health system reforms with expertise. He's an alumni of the Boston University School of Public Health in USA, where he obtained his certificate in management methods in international health. He's a fellow of the West African College of Surgeons, Ghana College of Surgeons, the International College of Surgeons, and a fellow of the Ghana Medical Association. This man currently serves as a member of the Ghana COVID-19 Task Force, Ghana's Vaccine Production Committee, Garden City University Council, and chairman of the Cosmopolitan Health Insurance Board, and also the Ghana Health Service Council, and the Ghana College of Physicians and Surgeons Council, and doubles up as National Health Insurance Board member too. The man I'm about to introduce to you is Dr. Anthony Nsia Asare, Presidential Advisor on Health at the Office of the President of Ghana. Good evening, Doctor, and welcome to the Ghanaian Community Awareness Forum. This forum, as I said earlier, the intention is to educate our people, inform, and become aware of the issues, if not already. So tonight we are privileged to have you, and thank you once again for your collaborative work with me and responding to messages and our request for you to appear. We hope by the time you leave tonight, our audience will be up to date with what is going on, and hopefully we will all be on one page. So Doc, I'll leave you to take over and take us through what tonight is about. Our topic today is testing at Kotoka International Airport. The protocols, the test results, the rationale behind it, and all the myths that have been going on, all the WhatsApp messages, all the videos we've been seeing, all the hearsays that we all hear from one person to the other. We are not here to talk about efficacy of any vaccine, because by now we have all heard much more about that. But you hopefully take us through anything that you believe will help us to understand things a bit more as Ghanaians living elsewhere, and even including those who are logging in from Ghana as well. So thanks, Doc, and please take it from me. Thank you.
Thank you very much, Emmanuel, and I'm very grateful to all of you. And I'm also very honored to be invited to speak to this august body, our brothers and sisters diasporians in UK and those who are joining us from Ghana. Good evening to all of you. What I'm going to do this evening, I'll give you a quick update, the situational update of COVID-19 pandemic in Ghana. Then I'll go to also tell you something about the airport testing, why we even introduce it, what are the protocols, how are the test results given out, and what we do after the test. And I also will tell you something about after COVID, what next, the lessons we have learned from COVID and what we want to do as a country. As you are all aware, Ghana started seeing patients. The first 2 patients that we saw for COVID was on the 12th of March, 2020. And since the 12th of March, 2020, when we had our first 2 patients, and all the first patients who came were tested positive were from outside. So we believe strongly that COVID-19 is an imported disease like any other place. You know, it originated from Wuhan in China. And that's one of our heads of states in the world said it's a China virus. So we all know it's China virus. So we had the first 2 patients on the 12th of March, 2020. And since then, we started with only 2 laboratories, one in Accra, one in Kumasi, Noguchi, and KCCR. And they did a very innovative things which they were doing what we call the pool testing for PCR. So till today, from the time that we started testing, we've tested 1,700,572 persons, out of which 485,403 are tests that we have done at the airport so far. And the total number of positive cases to date is 124,740. which means that the positivity rate in Ghana is about 7.3%. The airport, out of the 485,000 people that we have tested, what I would say is that we've been able to pick out 2,754 persons who are positive. What it means straight away is that from our point of view, these are potential people who have come with different strains or different variants of COVID-19 into Ghana. It is about 0.6% of all passengers. Everybody thinks that, oh, why are we doing the airport testing? At least we have picked out 0.6%. It's not everybody who passed through the airport who is positive. And out of the 124,740 number of cases who are positive, 119,229 have recovered. So which means our recovery rate is very high. We have a recovery rate of about 95.7%. And unfortunately, we've lost, as at 13 September 2021, 1,116 persons. Our case fertility rate is also not too high, it's about 0.86%. I say unfortunately because we thought we should not lose any patients. So active cases, which are our concern, including the airport positive cases, who have not recovered yet, is 4,395. If you look at our epic curve, you realize that we have gone through 3 waves. We have the first wave between June 2020 to the end of July 2020. And then we have another wave from January to March. This is after the Christmas festivities. And then we started having a third wave, which was also a wave that we had following the Indian second wave, which had the Delta variant. What I would say is that the first 2 waves were deadly, but not as what we have seen in the third wave. The third wave, we've lost many more patients than the first 2 waves. And a lot of people are sick or sicker than in the third wave. So what Ghana has been doing so far is that since we started having the first cases, we put together a national task force, which is chaired by His Excellency the President. It's all government approach. We're using all society approach as our strategy, and we are using science and data as also our strategy, and also legislation. If you remember, we put in a lot of legislative instruments. First, to lock or partially lock some parts of the country. We did it in March to make sure that we can learn the disease very well and know how the disease behaves and spreads. And we realize that most of the disease moves to where people are. So we have a lot of cases from the most populated and the most vibrant areas like Greater Accra Metropolis and Greater Kumasi Metropolis, plus the adjacent and surrounding municipalities. And that's where we have a lot of cases. For example, Greater Accra alone, or Greater Accra, which I mean that the main Greater Accra Metropolis have more than half of the positive cases that we have in the country, followed by the Greater Kumasi Metropolis, which has about a third of it, and the rest of the 15 regions share the rest. There are few cases in the northern part of the country. Most of the cases are at the southern part of the country, from Kumasi, Bono, Ahafo, Bono East, Volta, Eastern, Central, and the Western region, and Greater Accra for that matter. So we've been trying as much as possible to make sure that we don't have a devastating impact on our health systems. As we are aware, we don't have a lot of critical beds, so that if you have a lot of patients who are very critically ill, it will overwhelm our system, and it will overwhelm the health systems in total, including the health workers. So what we have done is to make sure that this impact is minimized as much as possible. So we put in a lot of restrictions. Schools were closed. We banned all festivals. We banned funerals. We also closed the borders. If you remember, all the borders as we speak now have been closed except the airport, which was open for passengers on the 1st of September. So when we were about to open on the 1st of September, what we did was to make sure that the airports are also well controlled so that we don't import a lot of cases into the country. So we thought about what should we do at the airports. If you remember, when we close the airports and then we have to bring in Ghanaians and some other people back home, we mandatory quarantine or isolated all the people, about 1,065 passengers who came in. And we have about 10% of them testing positive on the first day and then the 7th day. So we realized that there were a lot of imports coming from outside. So we tried to find a way. Doesn't mean that we have to let everybody who comes into the country isolate or quarantine for some period of time as other countries are doing. Or we allow everybody to come in and infect Ghanaians. So what we did was that, no, let's find a way of making sure that we limit, it's not abolition, but we limit importation of any virus from outside the country, especially since we have only one international airport. It will be easier to manage that airport by making sure we put in a test, which will be done in such a way that the test will be very sensitive, the test will be very effective, and the test, when it says that you are positive, it means you are positive. When they say you are negative, you are negative. But as you are aware, it's not all tests are not 100%. But the PCR is the gold standard test that everybody does. So there were a lot of people who came in, the vendors came in. So we are looking for a test which will be done rapidly, will not allow the people to wait at the airport for a long time, and also will not also put a lot of strain on the country so that we have to put all passengers in hotels and then do the test, and maybe after 48 hours when the PCR results comes before the person is left. Luckily, there were some people who are very smart who were also thinking about all these things. So they have come into the country, and before any test case can be used or any equipment can be used in the country, our Food and Drugs Authority, which is a well-renowned Food and Drugs Authority, it has a WHO maturity level 3. So when it says it is good, the WHO takes that is good. So they have done a lot of registration and a testing of all sorts of kits, which were coming in, both rapid and also PCR case which comes in. And we're looking at a test which is standard, which is about 99% like a PCR. And luckily, we have this immunofluorescent antigen test. And I want to repeat it, this immunofluorescent antigen test. It's not an ordinary rapid test that anybody can do in the bedroom or in the bathroom. So before we open it, Food and Drugs Authority tested and realized that the test is about 99% plus to a PCR test. So it means it's an acceptable, has a high sensitivity, it has a high specificity, and also it can be done as quickly as possible within 15 minutes. So the next question was that, will the passengers go to a hotel or the test can be done at the arrival hall? So we realized that we could do the test within the corridors of the arrival hall so that before you get down, the test is done, and before you go through your system, the results will be out. Our Health Facility Regulatory Authority, which also regulates all the laboratories and the clinics in the country, also came to look at the place to make sure that nobody will be infecting other people within the testing area. So these were all done, and then we allowed that the vendor can start testing once we open the airport from the 1st of September 2020. And that's what I said, that since the opening of the airport to passengers on the 1st of September 2020, we've tested 485,403. And out of that, 2,754 have been tested positive. Initially, when we started, if you test positive at the airport, we normally sort you out, what we say sorting out. And then once you are sorted out, then if you have any underlying illness or you have any comorbidities or you are sick, then you'll be admitted to one of our treatment centers. We're using the East Center where we treat patients. If you are unwell, then we allow you to go home and advise you, and our health workers will then follow you up. What do you realize at that time? I'll give you a story. There was somebody who was positive, who was allowed to go home. He was living at Sakumono. When the health workers in the district wanted to cross-check and check on that person, they called him when they were about to reach the house that he is at Akramo. What it means that the self-isolation which he was asked to go and do, he has left. And we all agree, it's very difficult to self-isolate. You have to be very disciplined. So we realize that if you don't sit down again and take a second look at it, we're still infecting other people. So far as some of us are concerned, it's better to be false positive than to be false negative. False negative means that the person is tested, is false negative, he goes home, and then go and infect other people. We have seen few people who were positive, who didn't want to be in isolation, and they went home, came back very ill. So we took another policy decision that can we mandatory isolate all positive cases, since it's only about 0.6% of the total passengers. One, either at our isolation center, which is the government isolation center at Medina district near Pantine, or let's look for hotels. Other is a first class hotel, or second or third or fourth, where anybody who wants to go to a hotel of his choice will then go there, but the person will pay. Two, when we are in pandemic like this, we are supposed to take care of the citizens of this country. So any Ghanaian who walks in, we offer you that you have to go to the National Isolation Center. If you don't want, and you want to go to any of the hotels, it's at your own choice, and you can go to a hotel. So it is never true that everybody is forced to go to one hotel. Maybe during the implementation, maybe somebody at the airport feels that, why don't you go to Hotel A or Hotel B? That one is something that we have sorted out. And we did all this thing also having in mind what happened after the Christmas holidays. Because the Christmas festivities, a lot of people came from outside. There were a lot of festivities, people were going out and all sorts of things. And we realized that from January, the case started going up until we reached February, March, where we have the highest number of cases, and we had a lot of deaths. So the decision was then taken, as I said, that we shall compulsory isolate everybody, mandatory. And if you are negative, we advise you to go home, and then the health workers will then do contact tracing and follow you up until 7 days, when they know that maybe you are harboring the virus, but we are in the incubation period. So that's how it happened. So one, anybody who is tested, after 12 minutes, the results comes out. You go through the port health, the results is printed out, and then given to the port health prints the results out and gives to the passenger. If you are positive, we take you straight to the area where we go and then sort you out. And when you are sorted out, everybody is then put in a vehicle and then sent directly to either a hotel where we have had arrangements of them to use as isolation center, or you go to the National Isolation Center. Then, after day 3 of isolating, we repeat the same test that you used to do, because if you use antigen test to detain somebody or isolate the person, use the same antigen test to also discharge the person. But luckily, on day 3, when you test, we take the samples again. We test you for antigen. We take samples for genomic sequencing to know the type of variant that you are carrying. That's what makes you positive. I can tell you that most of the cases which the test is negative for the antigen test is also negative for PCR test, because when you're doing genomic sequencing, PCR test is also done. As a principle, we don't confirm anybody. People have been asking, oh, I'm positive, please let me do a PCR test immediately to confirm. No, we don't do that. It's not allowed, because from the checks that we have put in place, from what FDA does constantly and continuously, the test is still very sensitive at 99% sensitivity. The test itself, the machine itself, it runs, it's not using human colors or anything. It's not a chromatography. It is a test which goes through a system and is run. There are also self-checks within a system where there are one positive, one negative control tests. In every, is 8 tests at a time. So 6 samples are put in and they are control tests for positive and negative. When you test positive, it's also taken out and then retested again on another machine, which FDA randomly also cross-check. So there's checks and balances by Food and Drugs Authority, and there's also self-regulation by the company who is doing the test. The company, the test, anybody who has passed through the system knows that the test is a complete laboratory. There are 2 laboratories, one for 1, 2, 3 gangs, and the other one for 5, 6, and 7. So when you come in there, you run through a place where the money is paid already before you come in. I'll come to the money. I'm sure people are concerned about the cost. You run through the system, samples are taken, it's run through the machines in the lab, and then it comes out, and then the results is sent digitally to the port health. And if it is not ready when you read the port health, you go through the immigration, you pick your luggage, and then by the time you reach the last stage, the test results will be ready. Normally, it's between 15 minutes to about 30 minutes. The longest time people wait there is about 1 hour, which is very, very efficient. Anybody who has gone through will know that that's the case. I agree. Anybody who is positive, including myself, if I'm at the airport or any airport and I test positive, I will feel first, it is not me. We go into a denial stage. But we also have psychologists there who take people through counseling. That is not the case. We want to save you. We want to make sure that if you are positive, maybe you are not having signs and symptoms now. Because in Ghana, about 80% of people who are positive are asymptomatic. Or maybe you are having underlying illness. We have seen people who are positive who fell sick whilst they were on isolation. We have seen people who were negative, but they were sitting next to somebody who was positive. They went to within 48 hours, they became positive, and they felt even sicker than the people who are their colleagues who were isolated. And there are people that we have lost, especially during this 3rd wave where we have the Delta and the Delta Plus variants, which is very virulent and is also very deadly. So there's a lot of advantages when they say you are positive and we are isolating you. Health professionals take care of you. There are nurses and doctors there who take daily care of you until day 3, and the test is repeated if you are negative on day 3 of the antigen test. Because the point is that if you are negative of the antigen test after you have tested positive, it means you cannot infect people as it is. The antigen test tells you that you are infective. A PCR test, even some of PCR tests can be positive after 14 days. We have even seen, there's also studies which have shown that PCR tests can also be positive even in the stool after about 21 days. So antigen test is a test which tells you if you are positive or you are negative, if you are infective or you are not infective. And that's the test that we are using. I can say boldly that I think Ghana is one of the only countries or the first country to start this type of testing. The next problem that people have been complaining about, one is the cost. Yes, we know that when we started, it was the vendor came in, is coming to set up a whole system. We all know that COVID-19 is not something which is going to last for a long time. In fact, we thought even by now, after 1 year of going through the system, we may be over of it, and then everybody goes back because people will be vaccinated, and it will maybe the vaccines that you have to look at if you are vaccinated or not. But that's not the case, because down in this part of the world, only in Ghana, it's only about 5.1% of the population who need to be vaccinated, who have been vaccinated. So we are now ramping up. There are some African countries where they are less than 1%. I know that at your part of the world, you are about 70% vaccinated. But it doesn't mean that somebody who is not vaccinated cannot come and infect somebody who is here, or somebody who is here cannot infect somebody who is even vaccinated. Once you are vaccinated, the only thing is that you don't get very ill or you don't die from catching the virus. So we want to continuously be saving the people until the time that we have at least some level of vaccination, which we are hopeful that we get before or by the end of the year or early part of next quarter of the year. Then we will then look at our protocols again and see what will happen. So the cost was fixed at 150 across board. But ECOWAS has a protocol where ECOWAS said that nobody traveling along the ECOWAS from one country to another country or holding ECOWAS passport should charge more than $50. So we have to abide by it because His Excellency the President is even the chair of the ECOWAS heads of state. So that one was something that we have to tell whether that either we like it or not, we have to reduce for anybody holding ECOWAS passport. Either you are Ghanaian, you are Ivorian, or anybody. Once even you are Ghanaian in the diaspora, if you show a passport from Ghana, you also pay $50. All other people who are not holding ECOWAS passport then pay $150. Yes, people can have the right to question that maybe now we have to be looking at the price again. Because when you talk to people, everybody accepts that the test is in order, it's good. People who have passed through know that it's very good. But the only thing that they already complain about that, can we do something about the test, about the cost? And initially, we also agree and negotiated with him that first, we don't test any child below the age of 5. What about children who are coming with their parents? There should be a family package. So I know that children between the age of 5 plus to about 12 are also, I'm sure they are exempted. So it's discounted. But we are still talking to the vendor to see after 1 year, can you look at the price, which when we reach the conclusion, everybody will get to know about it. The next issue that people have been talking about the testing is also where you go for the isolation. As for the isolation, it's a must. It doesn't matter who you are. Once you go through the test and you are positive, we isolate everybody. We used to give some things about the diplomatic corps, but we nearly got our fingers bent. So we have an arrangement with the diplomatic corps that they have a place where they do their isolation, which is under the supervision of Ghana Health Service, which is taking care of this pandemic. Anybody who comes in will be isolated. If you want to be in any of the hotels, either first, second, or third, very high hotels like Kempinski, you can go there. If you want to go to M Plaza, you can go to M Plaza. If you want to go to Mindindi or something, because you can go there. And we are all aware that there's a stigma attached to where you want to take somebody to. So because of stigma, it's a few of the hotels who have come forward to us that they want to use their places for isolation. And we use them, and later on, when we are not using it anymore, they fumigate the place, disinfect the place before other customers also go there. So this is how it is. So it is not true that it's only one hotel that anybody goes to. No. You can go to any hotel of your choice, and we'll look at it. If it's within the hotels that we have chosen, then we allow you to go there. So that is about the testing. So we are doing the testing to limit, not to stop completely, because you cannot stop. Because there will be people who have come in who are incubating the virus, or even somebody who is positive and is sitting by that passenger. If the person is positive, he can also infect, because you go to the toilet, you'll be sleeping, coughing, and then there's not much social distancing in the planes. So that's how it is. 2, we have also not taken a firm decision on what to do with people who are fully immunized. So if you are fully vaccinated, that one, we are looking at what is the dynamics of what is happening. We are also checking the number of people who came in of negative PCR tests, fully vaccinated, how many of them became positive at the airport when they are tested, and those who are tested and they are positive, and or those who are very sick, how many of them are fully vaccinated. So with all these data and the science will take a decision on what do you do with people who are fully vaccinated. So that one will come later on. So these are the situational analysis, and this is what the rationale, and then I think I've run you through the processes of the testing. And then the testing at the airport is done in such a way that you prepay. And there's a website where you go to, and then you pay to one of the banks. We know some people have problems with the payment and all sorts of things. If you have it, you go to the Frontiers website, they can quickly assist you. Or you can even let somebody in Ghana pay in cedis for you and send you an email or WhatsApp message for the receipt that they receive. So this can also be done. And before you come into the country, that it is also the protocol of this country that you should be holding a 72-hour PCR negative test. So these are the two layers of prevention. These are the two layers that will limit the importation of any disease into the country. One is the 72-hour negative test. But somebody will ask, if I have a 72-hour negative test, why should I be tested at the airport again? But I can assure you, I can tell you that even if depending upon the time that you did the test, which is negative, it's during that time that a lot of people come to you. It's during that time that you go for shopping and you meet a lot of people. It's within that time that people come to give you parcels, other money or something to bring home. And that's the time that if you are not very careful, you let yourself loose, and then you can also attract the virus. And as I said, you can pick it after the last day that you did the test to the time that you move into this country. So we are doing all these things to safeguard the lives of the Ghanaians and also those of you who are coming in to visit, so that you don't necessarily pick any virus from Ghana. As I've said already, because a lot of people have not been vaccinated, we don't have herd immunity. There are a lot of vulnerable people in the society. So when anybody comes in with any variant, when there are a lot of vulnerable people, people get a lot of infection. The person may be very strong, immunity is very high, and we have all realized that this COVID-19 behaves differently in Africa than any other part of the country or the world. Because everybody thought that we will be getting a lot of infection, and initially they said that about 3 million Africans will die, and the people will be dying on the streets. But God forbid, it hasn't happened by the grace of God. It may be because of the epidemiology of the demography, because we are a relatively young population, or it's because of the environmental problem system that we have in the country, or because of the temperature that we have. It's all combination of everything that we are still studying. Our scientists are trying to find out why we don't have the severe type of the disease, but other parts of the world have the severe types of the disease. I always say that God protects the weak, because God knows that we don't have the systems. The health systems are not so strong. So if you have the same type of the problem that we are having in other parts of the world, where they have a slightly robust system, then I'm sure by now would have all have been vanished from the surface of the earth. So this is how things are being done, and this is how we are doing it. And to go to what next after COVID, His Excellency the President, in the fellow Ghanaians or his regular updates, have been saying that I want to safeguard the lives of Ghanaians to make sure that the impact of COVID-19 is minimized. And he says another thing, that we want to also turn the pandemic into opportunities. So we are doing both. We are doing everything possible through the strategies we have put in place, through what you call the 3 T's. We constantly be testing, we trace people, we test them, isolate the positives and treat them. And then we've also added what we call the V. So it's 3 T's plus V. The V is the vaccination. We've made sure that we want to be very work towards having every Ghanaian, every adult Ghanaian vaccinated. The vision of the government is to vaccinate everybody in this country who is supposed to be vaccinated. But the target that we want to vaccinate about 20 million of the adult population by the end of the year, which you know is a target. If you achieve even 80% or 50%, I think we are moving forward. But we are hopeful that we will be able to at least vaccinate a lot of people. In fact, in the last since the beginning of this month, we have ramped up our vaccination to extend that as we speak now, as I said, we have vaccinated about 5.1% of the population. We have vaccinated total at 1.623 million total doses of vaccines have been given. And we still have about 1.7 million vaccines in the country at the moment that we are also continuously be deploying. And we have about nearly 19 million vaccines, which we are about to receive, which are in the system that will come also on board. So if you look at it all, a total of our 19.997 doses of vaccine are expected in the country by possibly by the end of this year, which we have committed ourselves to Johnson & Johnson of about 17 million. We still have about 60 million to receive. They are ramping up. We are going to have Pfizer vaccines of 1.33 million, courtesy the US government. The Johnson & Johnson is vaccines that the Ghana government has paid for it or has committed to and is paying for it once it's come. And then we're also having donations of AstraZeneca from the German government, which I'm sure you all heard about 1.5 million. And then we have also some AstraZeneca from UK government. We have had about one of them coming about 250,000. And we are having others which are also flowing in. Recently, we also have Moderna, 1.229 million, which the US government has brought into the country. So hopefully, we'll get enough vaccines to vaccinate the population of Ghana. Luckily, we have the system to vaccinate any amount of vaccines that we get within a matter of, if you get even 5 or 10 million vaccines, within a matter of 1 month, we can be able to vaccinate all Ghanaians because our vaccination, because of our experience in the expanded program on immunization, we do the vaccination from the community level and they are supported by the district and the regional and national level. It's something we've been doing because we are very good in childhood immunization. So we are using the same system to vaccinate the adults. And luckily for us, we thought hesitancy was going to be a problem. But I can tell you that when the vaccines are in, people go to queue as early as 3 a.m., waiting for vaccines to be given to them. So God being so good, we have not been having this problem that other countries are having. The third reason is that Ghana government has also, and with the help of some donor partners like UPS, and then Cosmo Energy, we have been able to deploy ultra cold chain system throughout the country. So any type of vaccine that we have registered, so far we have registered 5 vaccines. We've registered Pfizer, we've registered Moderna, we've registered Johnson & Johnson, and we have also registered Sputnik V and AstraZeneca. So any of these vaccines which comes into the country, we have the system in place to deploy it any part of the country because we have ultra cold system in the country. The third point is that our people are also very much geared up to, especially the health workers, to help in the vaccination. So what this government has done was that we realized because of vaccine nationalism and then the geopolitics of vaccine, it will interest you to know that in Africa, from our childhood vaccine that we give to children, 99% of it is imported into the country, into Africa. Only 1% is manufactured in Africa, which is in South Africa and also I think in Egypt. And then Senegal also started with yellow fever, which have not been going on well. So African Union, through an African CDC, have charged that Africans should be able to turn this tide from 99% to 40-60% by the year 2040. And our government, our president is very key to it that Ghana becomes a vaccination hub or domestic vaccine manufacturing and development hub in the sub-region. He puts together a team of 11 people who have worked closely together to make sure that we have a roadmap. And the roadmap is out. We have a charter, and we want to set up a National Vaccine Institute, which will coordinate manufacturing, regulation, financing, human resources, training. It's going to be a coordinating center under the Office of the Presidency, which will look at local or domestic vaccine discovery, development, and manufacturing. Ghana we are going to use the private sector. It's not the government who is going to put up the factories, the private sector who is setting up, and the government will give the enabling environment. We are working together with all partners. We are working together with investors, and it's very interesting that Africa has come together. The Africa Exim Bank is prepared to give financial support and also give investment support to any country who is prepared to do that. There's a coordination team at CDC who is coordinating the vaccine development across Africa so that we don't compete among ourselves. Because vaccine manufacturing and development is a very serious business. It's very capital intensive, and you have to have the market. So market demand is very, very important. Luckily, Ghana has what it takes to also manufacture vaccines. We have a very good regulator, who is the Food and Drugs Authority, which is level 3 maturity of WHO, which we are moving to level 4. We have the scientific society. We have the research laboratories. Noguchi, for example, is a well-renowned flu research laboratory for the whole of the West Africa sub-region. And then we have the KCCR, which is supported by the Germans. We have the University of Ghana has what we call the West Africa Center for Cell Biology and Infectious Pathogens. We have the University of Health and Allied Sciences which is also doing very well research. We have Cape Coast University, and then we also have the Tamale. So we've charged all of them to come together. As we speak now, the Noguchi and West Africa Center for Cell Biology can isolate pathogens. That is all what it involves in making sure that you have vaccines. You isolate the pathogen, you deactivate the pathogen, you put it into a system to formulate it and sterilize it, and then make sure that the adjuvants are all added, you fill it, you package it, and then you distribute it. So what we've done is that the committee has come out with a roadmap where we have strategically divided into a short-term, medium-term, and long-term. The short-term, because this thing started with COVID, the president and the government wants to have a fill and finish. Fill and finish is that the vaccine is already formulated, like what the Indians are doing at Serum Institute of India. So if, for example, AstraZeneca or Johnson & Johnson or Pfizer or Moderna or any of them, we are giving the fill and finish bulk, the whole bulk of the vaccines, and then we can then fill and finish it and then distribute it for the African sub-region and for Ghana for that matter. So we want to be self-sufficient in our vaccine needs, not only for the nation, but also for the regional ECOWAS system or Africa. The next thing that we want to do, we want to also, and then now there is a consortium of some of our best pharmaceutical companies, because we have a very robust pharmaceutical companies in country who have a footprint in West Africa. Already, Dan Adams is in Nigeria and other countries. We have a NS chemist who is also producing other medicines for West Africa sub-region. We have Kena Pharma who is also producing. We have the Phytoricus and the rest. So these three companies, Dan Adams, NS Chemist, and Kena Pharma, has come together as a consortium, and they are working together with Merck in Germany, Krat in Germany, Romalag in Germany, to assist them in the technology transfer to bring in the fill and finish vaccines within the next 2 years. I'm happy to say that the most important thing is the machine to the plant for the fill and finish. They managed to locate a plant which would have taken 14 months, but there's one which was installed recently in one of the European countries that they are bringing to Ghana. They've already committed themselves to it. They've paid part of it. And by the end of the year, the machine will be here in Ghana. And then we are hopeful that by the second quarter or so, we will start the production of one of the vaccines which we are yet to choose. We want to choose a vaccine which will be acceptable, if for nothing at all, in the West Africa sub-region, and also for that matter in Africa, working together with African Union and African CDs. And then we, at the same time, we also would like to, there's a company here who wants also to do a fill and finish for anti-snake. we don't want to go and buy anti-snake venoms from India again, because we are working for India. So they will do a fill and finish and also develop the anti-snake venom, because the snakes are here in Ghana. The snakes here are different from the snakes in India and maybe in South Africa. So that is another way that we are going. So we are going into biologicals. We are making sure that we can do our own biologicals here, including the other things. And then we also will then let Food and Drugs Authority have what we call the lot release, so that Food and Drugs Authority can also assist and regulate these factories very well, so that we can get WHO approval, and then we can also have market in the African sub-region. The same way, we will then start the technology transfer and the training of human capital for these factories and also for our scientific society, because research and development is the beginning of discovery of the pathogens and the beginning of any vaccine production. So we are going to encourage and then infuse some money into the universities for them to strengthen their capacity in the universities for these things, like Oxford has done. And so far as some of us are concerned, that's the only way that our universities will become self-sufficient and win themselves from government, and then do things that they want to do, as the scientists are all there to do what they are doing. There are a lot of Ghanaians outside Ghana in the diaspora who have written to us, who have shown interest that they are prepared to come and assist us with technology transfer. We are working together with African Union, we are working together with EU. I'm happy to say that tomorrow, God willing, about 4 of us are coming to Brussels to meet the EU delegation to discuss and deepen this collaboration to start the production as quickly as possible. So we have gone further than what the Nigerians and our brothers in Senegal and South Africa are doing. We have shown them our roadmap. We are the only country who have done a roadmap, who have committed to this. We are taking this thing through cabinet, which have already gone to the president, who he has accepted. There's going to be a national vaccine institute, which will coordinate all these things. We don't want it to make it a political gimmick that maybe another government will come and say, oh, we don't like it. So we are taking it through parliament so that it will be backed by act of parliament. And then I know that bipartisanly, everybody is happy about it. And then we have a standalone National Vaccine Institute, which will be coordinating all these things. So that is in the short term. In the medium term, which is the next 5 years, we will deepen whatever we have done in the short term to make sure that we establish well, not only for fill and finish for COVID vaccines, but also for our childhood vaccines, which are about 13 different pathogens that we look at. So there will be 13 different vaccines that we want to also manufacture here in Ghana, or at least do part of the manufacturing in Ghana. Now we get most of the support for our vaccination for childhood illnesses through Gavi Alliance. Because we are lower middle income economy, we are transitioning out of Gavi. So we have to buy our own and procure all these vaccines. So we want to have vaccine self-reliance. We want to have vaccine security and health security. So when we start doing this in the next 5 years, then we are working towards the transition so that we can do our own vaccines, have our own vaccines to use, and also sell it to outside world. And we'll continue building on our research and development. We continue building our capacity, human capacity, so that we get very good jobs for our university graduates. So this is going to be a system which will bring in direct foreign exchange. It's going to also create jobs, very decent jobs for our university graduates. It will also change the type of training that we do in our universities, so that we train our scientists, we train our pharmacists, we train our biomedical engineers and our engineers and chemical engineers towards proper manufacturing in the country. And in the next 10 years, God willing, what we want to do is to have Ghana candidate vaccine, so that when there's any pandemic, we can also say that AstraZeneca from Oxford, BioNTech is doing Pfizer, Ghana, maybe University of Ghana, together with some other company is doing GhanaVac. So this is what we want to do. The next thing that we also have realized, apart from the medications, that Ghana doesn't have enough hospital beds in the country. Because we realize that there are whole districts without any things like hospitals. And I can tell you that there's also districts, the 260 districts, 88 of them don't have any district hospitals. Our system that we run in this country has a tier system. It's a 5-tier system. We have the lowest or community-based system where we have what we call the CHIPS. It's a basic system which takes care of about 5,000 population. Then we have the sub-district, which is where the health centers are. And then we have the district hospital. The district hospital is the first primary hospital for referrals. So if you look at it very well, somebody even in Accra, for example, at Jamestown, when that person is sick, if he doesn't go to a private hospital, which most of them cannot afford, they just get up and go straight to Kolebu. Kolebu is a tertiary institution. It should pass through a referral system. I'm sure you see your GP first before the GP refers you. There's nothing like that in Ghana. Anybody walks anywhere. So where Kolebu, Konfanochi, the teaching hospital who are supposed to do training, research, and also teaching are now mundane of primary cases that they cannot see. All these things should be seen at the district hospitals. Because you don't have some districts without hospitals, there are some districts without a single doctor in that district of a population of about 140,000. So His Excellency the President said hospitals are being built over the years since Gojibel's time. But now he wants to fast track the building of district hospitals in all districts without hospitals. And that's what we are going to have 101 fit for purpose, well-equipped, well-equipped and well-resourced hospitals in all the districts without hospitals. So there will be 101. And then there are new regions which have also come out in Ghana. There are 6 of them without any regional hospital. They are the secondary level where we are specialists. So we are going to have all the 6 new regions of also well-equipped, well-built, fit for purpose regional hospitals. And then Takoradi Hospital also, there will be a new hospital for Western region, Takoradi. So there are 7 regional hospitals. And if you look at mental health, our only psychiatric hospitals are down south. They are at Ankafo and then Accra Psychiatric Hospital, which was built in 1917, and then Pantai. So we are also putting 1 psychiatric hospital for mental health services within the middle belt in Kumasi, and another one also in the northern belt in Tamale. So if you add all together, we are going to put up 111 new hospitals. That's the reason why maybe if we hear Agenda 111. This, apart from whatever the government is doing, building a renal and urology center at Kolebu to take care of transplants, building new maternity and children's block in Kumasi, and also in Kolebu. But this is one of the problems this is what we are going to do. So government is turning this pandemic into opportunities to make sure that never shall we come to where we are. So I'll end here for any question you also ask. Thank you very much.
Thank you so much, Doc. Honestly, you are so passionate with this job, and I'm grateful we have someone like you. You know your stuff, and I'm sure our audience have noticed that you've spoken for all this time without even a pause. So we will give you 2 minutes to go and get some drink, get your throat, wet a bit, because there are people already raising their hands before we started. There are questions there, so we are very grateful. Now, my audience, I want to bring to your notice that this program is brought to you by kind courtesy and partnership of Ghana Union UK, which I am the chairman, Emmanuel Kwesi, and also with the support from Ghana Nurses Association UK, the Western Region Nurses Association UK, the Nightingale Nurses Association UK, delivering this to you informative session about Ghana's airport testing protocols, myths, and test results that we have all seen circulating all over the place. We have had Dr. Isiah Asare, the presidential advisor on health, telling us all the things that he believes we should know. And we know what he's saying, a huge element of accuracy. And he's the right person to answer all our questions. War remit, what can we say? Without war remit, we wouldn't be doing this program. Some people might think, oh, it's a Zoom program, but there are a lot of other, hidden other costs, and therefore war remit has taken it. So we encourage you to take a look at World Remit and make use of it. We are going to go for 2-second commercial. World Remit has given us, some giveaways for the month of September. If you answer some questions correct, you could be supporting somebody in school in Ghana. If you are one of people like myself caring for people in secondary school and other places, you can be supporting them with £50 cash voucher or cash in your account to send it to them. We are in September, October, people are going back and other things. And also October, you can win the same. So we'll go for 2-minute commercial break, 2 seconds, sorry, commercial break. And I will go through those questions with you. Stay with us. We haven't gone to Q&A yet. There are a lot of questions that I'm sure all of you will be raising your hands for. If you want to do so, please do so now. Put your hand up, because first come, as I'm sure you know, will be first served. So we will go for commercial break and we will come back. Thank you very much.
World Remit helped me give you the best start in life. Even if I couldn't be there to see it. I know it wasn't easy comparing yourself to your friends, but the money I sent home meant that you could be right there alongside them today. I'm so proud to be your mother, almost as proud as you must be now that you're starting an incredible new chapter.
This program is brought to you by World Remit, a fast, reliable and better way to send money.
Welcome back, and I'm going to share my screen quickly with you so you can take a look at some of the questions for you. Look for the answers for the next forum. We will do a draw on the next forum, not today. So that at least by the time you leave here, you start going around looking for the answers. It's just an awareness program, education program. We need to let people know what World Remit is all about. And if you come next 2 weeks and then you can win £50, I'm sure it will make a big difference. Which of the following ways can you send money using World Remit? It can be cash pickup, bank transfer, mobile money transfer, airtime top up, all the above. Go and find the answer. We'll do the draw next 2 weeks. From how many countries can you send money using World Remit? Is it 50 countries, 100, 130, 140, 150? We'll do the draw next week. For how many countries can you receive money from World Remit? There's a sending countries and receiving countries. 50, 100, 130. Which of the following platform can you use to send money using World Remit? From only the mobile app, that's one answer. From only the website, from mobile and website, and none of the above. How much can I get if I refer a friend using World Remit? They do referrals. If you refer a friend and the friend uses them, you can get something. You can get £10, 15, 20, 25. Which of the following mobile money transfer companies are partnered with World Remit in Ghana? You send World Remit money from here, which partner in Ghana will take it? MTN, Airtel Tigo, Vodafone, or the above? What currency can I receive money using World Remit? GBP, British pounds, US dollars, Ghana cedis, Ghana and US dollars, none of the above. So these are very easy questions. You can do your research and win 50 quid. Do your recipients need mobile money account set up in advance before they receive money when you send? If it's yes or no. Why will I choose World Remit? 1, because it's simple and reliable. B, fast and safe. Low cost, and all the above. Which year did World Remit started its operation globally around the world? 2009, 10, 11, 12. Go to their website, search about them, use them, and you'll find the answers there. What do I do to create World Remit account? What do I need, to create World Remit account? Email address, full name, password, sending country, or the above. 90% of all remit money transfers are received in less than 10 minutes. True or false? Quite simple. How much does it cost to send money, send £100 to Ghana with World Remit? 0 fees, 99p, only 2 answers. It's quite easy. I have to say, I am not going to take part of this, answers myself. So don't think I can win it. I am not going to. None of my team behind the scenes will be part of it. So, in which country is World Remit headquarters based? Where is World Remit? Where can we locate their headquarters? Canada, United States, United Kingdom, Australia. And finally, which of the following money transfer options are part of World Remit groups of companies? Tap Tap Send, SendWave, Pay Angel, Express Pay, MoneyGram. 2 weeks from today, on the 1st of October, we will do a first draw where you can win £50, 50 British pound, equivalent to 500 Ghana cedis. Support somebody you are looking after or you are supporting in Ghana, or you can even use it for your own shopping if you want. So I'm going to stop sharing my screen. What have I done? Right, stop sharing screen. Right, okay, sorry, my apologies. Right, so welcome back. High Commission, Ghana High Commission support this program. They have been very keen to make sure we get these information to you. And we thank His Excellency also Nkrumah and his team for the support we get. Ghana Union, Ghana Nurses Association, Western Region Nurses Association, and of course, Nightingale Nurses Association. In partnership with Omega Live TV, this program is being carried on Facebook, YouTube, and of course, on Zoom, as you are all on now. We will welcome Dr. Anthony Isia back again for the next 10 minutes to round up, if he has anything else to add, and then we'll go straight to Q&A. Welcome back, Doctor.
Thank you very much.
This is just the next 10 minutes so that we have 40 to 50 minutes for questions. A lot of people are keen about these topics, and therefore we have well over 150 who have logged in and out, plus those watching around the world on Facebook and YouTube. So we want to make sure we give them the chance to, and I have 22 questions sent in advance that I need to go through with you as well. Thank you. Take over, please, sir.
Thank you, Emmanuel. I think let's go through the questions. I think I've said a lot.
Right.
Let's look at
that is very fine. So thank you, Doc. I'm going to mix those whose hands are up plus those questions I have received in advance so that we are fair to everybody. So if you want to ask a question, this is your time to raise your hand up and we'll go through the list. First that I have, I'm going to go through one of the lists that I have. When someone tests positive on arrival at Kotoka Airport, how many days gap do you test them again while in a hotel or government facility? So you have arrived, you've done 42 or 72-hour test, you've left UK, you arrive in Ghana, all of a sudden you are now positive. They take you to a quarantine in a government facility or a hotel, as you said, of your choice. How long does it take to test you again? Please, sir.
Should I answer?
Yes, please. Oh, you can do it in 2 ways. You can either take 3 questions and answer them in one, or we can
I think that will be better.
just to save time. That is first question. How long does it take to test somebody who has been tested positive on arrival and is now in quarantine in any facility that has been chosen? Secondly, how do you explain the situation where one tests negative 2 days before arrival in UK, Canada, or anywhere else, and then tests negative on arrival, and then 2 days into their compulsory quarantine test negative? How do you explain that? So I am leaving today, I've done my test yesterday or day before yesterday. I am sure I can travel. The airlines have taken me to Ghana. I got to Ghana, all of a sudden they said I'm negative, I'm positive. You take me to a hotel or Pantine or wherever the facility is. 2 days later, you come and test me again. Now I'm no longer positive, which we have seen a lot of WhatsApp messages going on. How do you explain that? And then the third one on this list is to say that when someone tests positive on arrival, how is it possible to test positive on arrival within 48 hours of testing negative prior to departure? How is it possible that you test PCR? And as I'm sure you've highlighted some of it, but it's a question I want to ask. Because that's where the doubts and the myths are centered on. So if you can answer those three, I'll go to the chat room and take 3 questions from there.
Yeah, thank you very much, Emmanuel. The first question, how long to repeat the tests after you are positive at the airport? The second test is done on day 3. So day 3 of your arrival in isolation, the test is repeated. And when you repeat the test, we also take advantage to do genomic sequencing. And while you are doing genomic sequencing, the protocol is that a PCR test is also done. So it's genomic sequencing, and we also do the test that we did, which is the immunofluorescent antigen test. So it's day 3 on arrival. Somebody asks, how is it possible, or why does somebody test positive, negative, and then 2 days later test negative, test positive, then 2 days after test negative? I don't know why the person was tested on the second day. We normally test everybody on the 3rd day, but it's possible. For all you care, the person is incubating the virus when he did the 72-hour negative test, and within the next 48 hours, he can be positive. And you can also become negative again after the day 3. And then somebody asks why you test 48 hours before arrival and then you test positive. I think I've explained that one also. Because during the 48 hours that you have done your test, or 72 hours you've done your test, that's the time that you move around a lot, you meet people, you are collecting parcels and money for other people, and it's possible that you can test positive.
Thank you, Doc. This is just from me. If you have tested today or tomorrow and you leave for Ghana tomorrow evening, you've got your result this morning, how long does the virus itself take to be able to mix with your blood or wherever it does in your body for that test to become positive? Because I got a sample taken last night, I got the result this evening, I am leaving tomorrow. From what we have been made to understand, it takes a minimum of 3, 4, 5 days. And that's why most national borders request 72 hours. So how come you've got your 72 within the 72 of arrival, and then all of a sudden you get to Kotoka and now you are, how long does the virus itself take to show itself in your body before you test positive? From your medical profession, this is not about the test itself. I'm just finding out from you.
Yeah, the incubation period takes anything from 48 hours.
48
That's
hours.
2.
Right. Okay. Thank you. I'll go back to the those whose hands are up, and I'll read some of the chat questions for you. Gatekeeper, please. There's someone called Gatekeeper. If you can ask your question, please.
All right.
Mute yourself and ask your question.
Yes, thank you very much for allowing me to speak.
That is, if doctor can speak Fanti, then that would be
my
fine.
wife is a Fanti. I can understand Fanti. I'm Ashanti. So.
Okay, no pocho. Mampele maybe saying there. Kasa ekeno. Ahumu ma fine. Memu de. Oye wejumenti etum akasa ye pa. Na I can't be there. Say what do airport wa? Na say what test positive. What service do was a one. As in those who test positive, there is a counseling service that is given to them. Now, I've been through Ghana twice during this period with people who tested positive. And I'm sure many people can attest to the same fact there. Say a test positive, when you work on your counseling, it is actually one. It's like you've done something wrong and you are being taken into jail to be kept away. So their anxiety levels gets higher. And I want to know which medical body is giving this counseling. Is it the Ghana National Health Service or the same company that has been contracted to do the testing? The second question that I have to ask is, why are we so much laying emphasis on the private sector when we have government hospitals and bodies that can help in this facilitating this service for us?
Thank you, Gatekeeper. I guess we got your two questions. Can I add one more question, Doc, before you come to those answering? We've got somebody called Cecilia Ketia. If you don't mind to be highlighted to speak, can we see you, please, if possible?
Thank you so much for the permission. I was on mute because I was at work now.
Okay.
So my question, half of it has been answered already. The contract being somebody outside Ghana Health Association or whatever that health body is in Ghana. Why are we contracting somebody from Ghana? But if I listen to you very well, you are trying to establish a vaccine using Kolebu, using Efiam Kwanta, but with this particular one, the government is still trusting outsiders to do just COVID testing, and it's only just the instance, the POC. My second question is, if ECOWAS is speaking on behalf of people traveling within West Africa neighbors, why is it that all of us from other side of the world have to pay $150? And we know that if the price can be 50, why can't we also benefit? Because we don't just take advantage of Ghana. We come to Ghana to support. We send remittance to our family members there. So you all know the benefits you get from outside of us by virtue of using foreign passports. We are not being taken care well. It's only when you need our money. And I think this is not very fair for those of us.
Thank you, Cecilia. Doc, please go ahead.
Thank you very much. I'm Oka Fantino. I'm a contano.
Oka Fantino, do be no other than rough. Which me
Sana Fantinity. Yes, you clinical psychologist. Now, and yet, more test, and then be a casa one more test and also more forming in Ghana Health Service, Port Health. Your clinical psychologist are more. Now, the woman say, you don't find it, you are Timbia, so go away, be Omoya, Ubikra, I don't know him, and won't require now I have seen focus. Into constantly Ghana Health Service in Penny for in Icon, Echo Shady Omoye, in your reports, the no Casa. For example, Tema hotels issue by so M Plaza and Comfort, yeah, you want in your name, and the way and I said, Sa Hotel, I didn't want to mention the name. A Danny be wa, then yet, or more close to the crab. And I'm saying the panel Dawson. The other Bemone said, tell me a benya new variant, be a free outside the piano. You pay a positive for airport to know a Dawson chair, normal. They say, you can say, you be a conformal. If you grab 2 days now, will be a positive, then negative, will be an age of one will be a coffee. And if I don't swan, then the Pepe Hotel, the Emma hotels in be Eddie Adana or Matutuma Biana and Kofonko. Say, what hospitality industry and a coffin crowd. Dibiana Dano or what? Omonia preparation in Mabia, but a bass. I dare we be an hour here, China with Tianko for Mukasa. Ghana Tourism Authority for also ACO. You say, Omo, a check hotel, Nibia, Sebea, Ubiokoda, Ubiano, Se Obeyen, Papano, Ubiakoda, Hosebia, or Nibiamba. It's sanity. Inti, as me can't face them. What is a positive? Normally, you have a problem. We also have problems where Omoa passengers are tested positive for Omoa assaulting for airport and so on. We are sure say in UK, you cannot assault somebody who is doing his job. But we Bahwa, Drew, it thinks he knows everything. And at the idea who be emotionally say, Sebio, you animal will be a wabu, you think Adibia and Ghana be IF. We are doing this in the US, you don't do this, in the UK, you don't do that. Country be a sovereign country. Be one protocol, meaning say UK. Woodrow says here, can you be saying about UK? Say, intimate because a time my ban is short. Woodrow says here, Ufri Ghana, a back country, you be quarantine for about 5 days. Somewhere be about it. And nobody talks. Bien who been an okasa. By the year be Ghana, Africa, she said, maybe a free ban. What the year? Go focus about the cost of name. We know the price and the test, the money that you pay on UK, which I would test is it day 2, and I think day 5 or day 8. Before you come there and come back, for 7 days, not 10 days. Why a test bear you know me, and you'll be running into about 200 or 250 pounds. Nobody mentions it. Yeah, what protocols I follow country. And these are our protocols. Then but taking me time, I actually must have obey 72-hour PCR test. And no we are positive for ultimate trampoline. Go for the Yareni Biaba country, the continue ever country, Yareni in free Ghana, if you are an enemy. Here they limited importations. You didn't say, would you only be or Praprano, when who see it would do airport, obey a test. What countries you would do airport straight to a hotel at your own cost. We are negative or we are positive, we'll be to your hotel bill. Sana, I have test results no bar. So 48 hours, 24 hours are now coffee. And Obiankasa. Here the be away negative, which is about 99.4% of a year tested. Obia Kunifi.
All right.
Obiabusa say, somebody asks, why is government not the one doing the test? Is the private sector who is doing the test? Private sector is the engine of any economy. And maybe the person didn't listen to me very well. I didn't say that Kolebu and this are the one going to do the vaccines. No, the vaccines are going to be the machines and the factories are going to be done through the private sector. Government is giving an enabling environment. Government is providing all the necessary things so that the person, if he wants to get money from outside or anywhere to do the work, government will support it. Government will give off-taker. But most countries who have developed, it's not the government which develops countries. It's the private sector. And the government gives private sector the necessary encouragement and the environment to do the work, and government collects its tax. The time that the test was institutionalized that we are going to do this test in Ghana, the company you are talking about, which employs 360 Ghanaians, was the only one who has brought such a test into the country, which was accepted or has the 99% sensitivity, which was what the benchmark that the FDA and the HEFRA and everybody put out. Kolebu didn't have that test. Kolebu doesn't even do that test. People are saying, why should Noguchi not do the test? Noguchi is a research lab, which we asked to do the test. Noguchi didn't have that machine or that test. Government facility, no government facility had that test. If there was anybody who has that test and you have gone through the Food and Drugs Authority and it's accepted, it can be a vendor. Now, if you go to the airport now when you are coming back at the departure, there are about 5 different companies who are there who are doing the 72-hour PCR test. It's been open up because people have brought in the kits, people have brought in the machines, and we don't have any problem when a lot of people are doing the machines. So it is not true that government has somebody who wants to do it, and then maybe other government authorities, facilities can do it, and we didn't allow them to do it. That is not the case. As at June, when we started thinking about this in July and August, especially, when we decided that we have to get a test like this which should be run in the country, there was only one person who could come forward who had that to do. And 2, it is not an ordinary machine which has put outside and anybody does the test. People think that these are tests that, for example, you take the rapid test, you go into your bathroom like you're doing pregnancy test. We saw the video which was going around, and he's taking her own test and I'm testing it. Nobody knows where he took the sample from. Even PCR, if the person who is doing the PCR is not the same person who is taking the samples and then it changes. It is somebody who has been trained. So if you take the sample from your palate, maybe you take it from the top of your mouth, not inside your throat, and then you put it into what the lady was showing us. Who should take it? Nobody will take it. Because we want to be very professional. We want to take the test from wherever it's coming. So the question of why government is not doing it, we are moving away from everything government. We are moving into a situation where a private sector does whatever it's supposed to do. It does it very well. In this part of our country, everybody talks about the cost, but not the value. So you should look at the value and compare it to the cost. The last question was, why can't those who are not holding other passports from other nationalities outside ECOWAS pay the same price? I said that we are looking at all these things. But the problem is that those who are coming in, it's not only Ghanaians who are holding other nationals' passport, other nationality passport. Luckily, now there's a dual citizenship. I jokingly tell people that if you want to come to Ghana, you don't want to pay this, you want to use ECOWAS passport, go for Ghanaian passport so that we know. As at now, ECOWAS put a rule that every ECOWAS person should pay this. So whoever is doing, the vendor who is doing it, we didn't even argue with the vendor. We told her that that is a protocol within the ECOWAS sub-region, and we have to follow it. So the same way, we are now started also looking at it and see that if it is an investment, if you look at the investment that the person has done, then when he's moving out, this is not a long-term investment. It's a short-term investment. When he's moving out, he leaves the corridors of the airport the same way as he came to see it. So I think that's the answers I can give to you.
Thank you, Doc. Thank you. That's a good one. Thank you. I'm going to go to the chat room and raise some chat questions so that they don't feel left out. There's one, then I'll come back to the normal question. Somebody is asking, I've seen a chat that's saying, why are we doing this in English and not Fanti, not Chi? That I will answer. Ghana has various languages, and therefore Chi is not an official language for Ghana. We cannot meet everyone's language. I don't understand Hausa, and I cannot run this in Hausa. And I'm sure others don't understand Dagomba. So we have to use a language that we have all been known to, and therefore, please bear with us. We cannot use Chi as an official line for this kind of program. If you understand where I'm coming from. I speak a Hunter, and when I speak, I'm sure the guest will not understand what I'm saying. That's for sure. The next one I want to talk about is that someone is saying, I appreciate the need for the test, but when is it going to be reviewed to decide what exemptions can be given to fully jabbed travelers? Lots of countries are now looking at reducing fees to boost crumbling economy. Is Ghana looking at reducing PCR fees? That's one question, Doc. I answered the first one myself because there's no need for you to get involved with that. The next one is, I am double jabbed going to Ghana for my dad's funeral. If I get to the airport and test positive, will I still be expected to isolate? Of course, that one I'm sure Doc has already explained that one to you. And no one will be exempted from it. So if you are going to Ghana for your dad funeral, my advice is make time for the unforeseen circumstances of being housed in a hotel or somewhere, so that you have enough time to attend your dad's funeral. I think that's something that doctors need to get involved. And the next question I'm going to give to you from the chat is, the UK government has just announced that 72-hour PCR tests will no longer be required for re-entry to England for those who are fully jabbed, right, who have been fully vaccinated. Can you please advise, if possible, if this will be rolled out or will be still required for purchase PCR test in Accra from 4th October? So, Doc, two things. UK government says anybody in Amber country, including Ghana, which we come from, doesn't need PCR test to enter here. Is this something you can take forward to the president as you sit close to him? Or how are you going to remedy that for us?
Yes, as I said initially, we are looking at those who have the double jab, fully immunized. What should you do next? But the PCR test that you do when you are leaving Ghana, it's not a requirement by Ghana. It's a requirement by the country that you are going to. So if UK say you don't need a PCR test and the airline will take you, you don't have a problem with it. We insist on a PCR test of those who are arriving into the country. And in our protocol, we say that even if you come with PCR tests, we also insist that you do the antigen test to clear yourself. So that's our protocol. And we are, as I said, it is not cast in stone. We are in gold. What we are trying to do is continuously to be reviewing it, looking at our data here, looking at the science behind it, and then we review it. The next question is that those who have double jab, would they need to be tested in Ghana? I think you answered it, yes. Now, traveling is not anything which anybody takes for a joke. You have to make sure that when you are traveling, you also put yourself in all this and make sure that you all unforeseen circumstances. The reason why we do that, if you are positive, even though you have a PCR, even though you have taken 2 jabs, is that you can still infect somebody who is vulnerable. And there are a lot of people in the society who have not taken any jabs at all. So the time that we can have enough people who have taken the jabs, we will relax this. The reviewing our protocols, yes, is continuous process. We will review the protocol as at when, using the data and then the science behind it.
Thank you, Doc. I'm going to go back to the questions in advance, and I'll come back to those who have raised their hands. I've not forgotten you. One question I want to ask is, if a family of 5 living together in one household, all tested negative, travel to Ghana 2 days later or 48 hours later, one of them tests positive, what will you do to those families, the remaining 4? Are you going to quarantine all of them, or are you going to let the only one testing positive to be quarantined? That's number one. Number two, why do we take passport away from what we have seen on social media? Once you are told that you are positive, I am yet to confirm this officially. Please bear with me, correct me if I'm wrong. But from social media, your passport is taken away. Why is that the situation? Is it not quite illegal to hold someone's passport? And the government actually doesn't need to see someone's passport to send them to a quarantine, because you can do that by putting the information at the website of the airline that brought them, not to take them back. So we have had situations where people are actually frustrated that you're taking their passports away from them. Please, can you share some light on it for us, please, Doc?
Yes, if you have a family of 5, one test positive, we isolate the one who is positive. As I said, we isolate every positive case. The rest of you, the 4, we advise you to go home. Our health professionals will follow you up until you are about 7 days. Why do you take passport away? It's from what we have seen in the past. There are people who have tested positive. You take them to isolation, not quarantine. When they go to isolation, they run away. So immigration decided that anybody who tests positive immigration has, by law, has every right to hold anybody's passport as long as they want, and then give it out when things are normal. So we give it out.
But Doc, can I say this with all humility? Testing positive is not a criminal offense. The person has not committed any offense for their passport to be seized by immigration. How do you explain that?
Yes, immigration keeps the passport until you are discharged.
Against the will of the owner?
Isolation is also maybe against the will of the owner. There are laws. For example, if you are drunk and you are driving, and the police arrest you, it's against your will. You want to drink and drive, but if something is against the good of the people, the law allows that you are also stopped and your driving license taken away from you. The same thing.
Doc, I don't have opinion as a moderator, but when you drink and drive, you do it at will. You know the consequences of jumping on the road and what could happen. I don't know that I was going to test positive after 48 hours of test in UK. So when I arrive, I don't expect my personal belonging to be seized for testing positive. And passport is my personal belonging. It's not a question of. So please, I understand where you're coming from, but when it comes to will, we don't have any will to test positive at the airport.
Yes, but you see, you realize that I'm sure you are talking for those who will be going back, that you can inform.
And I'm talking for myself too.
Yeah, but there are people who test positive, who are in the country, who will run away. You don't see them again. You see, it's all mutual respect, mutual respect that they were not seizing or they were not taking anybody's passport before. But there was a situation which came in that passports were seized. I know that is something that they did temporarily to make sure that whatever protocol that they've put in place at the airport is working. And that one also is being discussed. I mean, if people are coming decently, they don't have any problem, why don't they keep their passports? As I've told you, a day after or even the evening, by the time somebody broke the door and ran away. By the time they realized, gone. We know some two Indians who also ran away. And they came back, we lost one of them, very sick. So the number of people that they've infected, you know where they went to? They were involved, they are minors. They went to Bogoso. And after 3-4 days after, we had a lot of cases coming from their camp. And we don't even know the number of Ghanaians that they infected. That's one of the reasons why we said that if you keep the person's passport, he will stay. So, and then unfortunately, it affects everybody. So it's a situation that we find ourselves. That's why people take that decision.
Thank you, Doc. I see. The reason why I said that it's taken against their will is because from what we have seen, once that passport go through the system, you don't even have a say as to whether they can keep it or not. And I think they should give people consent to sign a waiver to say, look, I am keeping my passport with you to show that I'm not going to run away. But just because I've arrived and it get taken away and I never see you until I test negative, I just don't think it's something that anybody plans to arrive in Ghana to test positive. It's not something you do at will. Anyway, we'll move on to the chat room questions. Those whose hands are up. I will call on Erekia Roberts, please. Erekia, if you are there to show, to give us your question. I'll come to VY and then I'll come to Abena or Kamala 10, please, in order.
Thank you for giving me the opportunity to ask my question. So I have two short questions. The very first one is, if you're a Ghanaian holding a dual citizenship and traveling on a U.S. passport, are you expected to pay $50 or the $150? That's the first question. The second question has to do with the testing centers in the U.S. So the question is, can you take the PCR test done at an approved center here in the U.S., or do you have to go to a trusted travel lab designated by Ghana? Those are my two questions. Thank you.
Thank you.
We'll
go next.
The second question, what did you say?
Can you repeat the second question, please, for Doctor? Rekia, you've muted yourself.
Okay, I'm back on again. I think it was muted. So the second question is, are you able to have the PCR test done here in the US at any approved US centers, or do you have to go to a trusted travel lab designated by Ghana in the US? So there is a form that lists a phone number for you to contact when you go on the website. It shows approved centers by the Ghana government. And we're wondering whether citizens here can go to approved centers by the US Health Department in each state and be able to present that during their travel to Ghana, or do they have to go to these, it's called TT labs?
All right. I don't know if Doctor will catch it, but I'm sure he will address that. Thank you, Rekia. Ivy, please. VY. That's, I don't know if it's IV or VY. VY, please. Do we still have VY with us? Time is of the essence, so I want to make sure I go through as many as I can. VY. If not, we go to Abena or Kamala at 10, please.
Hello, good evening, Doctor.
Yes.
And Mr. Secretary, Mr. Chairman, thank you for allowing me the opportunity to ask these questions. Obviously, I'm going to step away from COVID as most of the questions and answers have been touched on. Now, listening to Dr. Nsie's, discussions, he touched so much on things that are happening in Ghana, the possibility of building new hospitals and so on and so forth. Now, this is the government's second term. And as he himself admits, most of the hospitals in Ghana have no beds. Why is it that this hasn't been tackled for so long? And that's one question. And two, why build new hospitals when the old ones are crumbling and they are not being renovated and catered for, people who are sick, to give people dignity? That's two. And three,
Interior.
did you hear me? I was unmuted. I was
yes.
Right.
Sorry. Okay.
So did he? I don't know if I should go through it again.
If you can be brief, so that we have.
So I was talking. I was just saying that I was going to step away from COVID because a lot of questions have been asked, and that Dr. Nsia did say that the government is actually building a lot of future hospitals. Now he admits that the current hospitals have no beds. Why hasn't the government, since it's in its second term, worked on improving the hospital environment, i.e. giving people decency and some kind of, training people to keep hospitals clean? Why hasn't these things happened? If you can answer to me, please.
Thank you. I think that will be okay because Doctor is advisor to the president on public health.
Yes.
And hospitals is part of public health. So I'm sure he will take that answer to you once we get two more. Jason Otua Edujemfi, please. Jason.
Yeah. Well, Doc, I know you guys are working very hard to get everybody safe, and all those who are involved in putting people together and serving this purpose. We can only say, are you cool? But there are many concerns that goes on. Some of them, I know you have dismissed them. One of them being the woman who took photographs and PCR tests and so on and so forth, which for some, it doesn't matter what you say, she is still believed, because it was later revealed that she was well beaten, and then she was asked to retract statements. And when we hear things like this in diaspora, we feel unsafe to come home, despite all the efforts that some of you are doing. There are others too in the system who are corrupting it. And this is a major concern, Doc. So please, if you can see to it that, you fish out those who are trying to use the pandemic to make money, selfish money for themselves. That's one. And then number two is that you made mention earlier about the professionalism in doing the COVID testing. And therefore, it will not be legit for individual to just take a swab and then do a test. But what I can say is that when I've been to Ghana since this pandemic, I've been there 2 or 3 times. And each time I go for a PCR test, I do the swab myself. And here, even in the schools, 10-year-olds do their own swapping. And they have the kits and they do it themselves. So what is wrong if someone comes to the airport and is tested positive, knowing that it is not right, and he's got the kit and tested to show them that, look, here is my test. I've got so many kits here. Let's try it again. The person is actually denied and put in a hotel for 3 days and test again, and it's negative. And it is surprising that it's only in Ghana that when the person tests positive on a day, they become negative and they can go home. So it brings suspicion in the whole thing, So this is our concern. Please address that and then say something that we can feel very comfortable in, so that we can back you on this.
Thank you. Thank you. Doc, we've got 2 questions. I'm sure it's enough. We will make it brief answers because I don't want to end up having to run an extended version, because I know there is a lot of interest on the topic you are here to address.
Yeah, in the first question, if you are a Ghanaian holding any other passport, which is not an ECOWAS passport, as at now, it's $150 for the test. And he was talking about accredited facilities for the PCR test before coming in. Yes, there's a PanaBios. I think there's a website on PanaBios, which you can know where you want to go and do the test. In fact, if you do the test in any accredited facility, anywhere in the world, you can put it on the website. It's also accepted. The lady asked a question about there are many hospitals without beds. It's not true. Hospitals in Ghana have beds. I'm sure maybe it's confusing no bed syndrome with no beds. No bed syndrome means a lot of patients are going to one facility where they will not have a place to stay. That's one of the reasons. It backtracks the points why we should have hospitals in other areas. I think I gave a very exposition about everybody going to Kolebu when the person doesn't need to go to Kolebu. So if there are districts without hospital, those districts without hospitals, that's exactly what government is doing. So if you talk about no beds, it doesn't mean hospitals don't have beds. They have. And then the question is, why do we build new hospitals? Yes, there are areas without hospitals. They need hospitals. So we need to also allow them to have health care. And improving hospitals is an ongoing thing, which, the hospital is there already. So the management staff who are there, who are supposed to, we are training them continuously to make sure that they do professionalism and also keep those hospitals neat. I've been a medical superintendent, medical director, chief executive before. I think when I was one of them doing this work, we want to make sure that the hospitals are neat and the place where people go and stay and get good care. So improving hospitals and also building hospitals go hand in hand. But we want to give every part of the country, every district, a hospital where they will go to. And then there will be what we call no bed syndrome. People coming to, all of them coming to one site in Kolebu or Kofanochi when they would have gone to the districts for care. And he said somebody was beaten when he came in and have to retract the story. It is never true. Nobody touched her Even I know the Director General of Ghana Health Services went there to have a chat with her. And nobody forced her to retract anything. So after going back, and he says that it's her own word, but I can assure you that nobody beats anybody up so that the person retracts whatever. I've said it before. Anybody who tests positive will feel a bit that you'll be in a situation where you are stressed up, you have a denial stage. But it doesn't mean that that person should also be very abusive. As somebody said, we are working around the clock, trying to make that we make people feel well. And then we make sure we minimize the impact of this pandemic as much as possible. And one thing I will say, and I will say it here again, I think such behaviors, what people do, can never be done anywhere in the world. You can't do that in UK. You can't do that in Germany or even in US. That you become so insultive and start insulting everybody and they're making sure that everything that you are doing here is wrong. I will insist that we are a sovereign country. And as a sovereign country, we put in protocols and procedures to make sure that the good people of this country are safe. So if anybody comes in, you have to abide by whatever we are doing. And nobody should downplay and then feel that whatever we are doing here is wrong. And that because we are not doing things right or anything of the sort. I don't believe that is the case. Yes, I'll talk about professional. Yes, you know, children in UK, children everywhere can take a test. But the test we are doing at the airport is not the test that the lady did and was showing everybody. What the lady did is a rapid test that he put a thing in the this and put it on a slab and they say that this is positive or negative. Before we do those, we accept those. We don't accept those tests at the airport, or this is not the type of test that you are doing at the airport. So people should get it right. The sort of test you are doing at the airport is quite different from the test that anybody thinks that he has the test in the bag and he can do it. We don't do that. Yeah. So as I said, there's the protocol that we have in place. So if you are coming into the country, these are the protocols that you have to follow. These are the procedures that you have to go through. When you are tested positive, we will isolate you for the first 3 days. After 3 days, we will test you again. If you are negative, we will let you go home. There are a lot of them who test positive and then they continue testing positive even after 7 days. As I said, there are people who test positive and then within a few days, they end up in hospital because they didn't have signs and symptoms. But it means they were incubating the virus. So that's how it is done. So testing of, you cannot walk to any place and then if you test positive, for example, in UK, and I said that I've done my whole test to take my test, I don't think it's accepted in any part of the world, and it will not be accepted in Ghana. So please, I think I have convinced you enough. If you want to come to Ghana, traveling is very, very cumbersome nowadays. If you are coming, you know, as the moderator said, prepare yourself. These are the rules and regulations. We don't want anybody to come in and behave that he can follow, he can set his own rules and then follow the rules. It's not acceptable. Thank you.
Thank you, Doc. The next question from the list of questions I raised, and it's something that I want to share as a person. I do apologize for those who might think I'm taking over, and I will go through the other ones. There's a lot that we talk about arrival at the airport and the issues we get, but nobody talks much about when you are departing. My question is, Doc, how much control does the government have on those testing centers in Ghana to make sure that the accuracy of what they are giving us is not contested? And I'm going to share my screen with you for a second. Doc, this is me, Emmanuel Kwesi. I've only highlighted those dark because it's my date of birth and my passport number. Right? 29th of April, I think it was a week before, but this is the only one I can get. 29th of April, I tested positive in Ghana on my way to come back to UK. I stayed in Ghana. I did all the neem tree and everything else that I had to do. I don't want to name those who did to help me because they will feel shy. I'm sure some of them are on the forum. Now, fast forward 16th of May, after 3 weeks of doing all of that, 11:19 on the green, I go to Kotoka Airport. There's 2 testing centers called Omni and Ledin. One of them I did within a matter of minutes, 11:19. The result came, I got negative. You go to the next one, 12:02, between 11:19 and 12:02, on the same day, I did those, as you can see, sample collection, 16th. Sample collection here, 16th. So I walk from one center across to the other, all at the Kotoka. I'm sure you know where they are. Leiden is at the car park, and Omni is inside the airport. I got those two results. One tells me I'm negative, one says I'm positive. I quickly, quietly, because of desperation, used the negative to just return after 2 months of not-planned journey to Ghana. I come back to UK 2 days after my arrival. This is my COVID-19 test, day 2. I tested, not detected. So, and in between 29th of April to the 17th of May, I did almost 8 tests that cost me 40,000 Ghana cedis because of desperation. Because I was desperate to get out. After 3 weeks of whatever I went there to do, I'm not there to share. But how do you convince someone like me? This is my experience, that the testing in Ghana is something to be proud of. Because as far as I'm concerned, somebody tested me and told me I was positive on the 18th of May. I arrived here on the 19th. 2 days later, I test, UK test tells me I'm negative. Do you understand the frustration that because of that, actually, as I sit here, I am very concerned when I'm making a booking to go to Ghana because I don't know where I will end. And it is genuine concern that we are expressing. I wanted to show you this. I've deleted some of the details so that it doesn't become a public whatever. But I can send it to you in email with the full details if you want to go and check. But do you understand why some of us in the diaspora feel the way we feel about the test in Ghana? Secondly, why is it that the government, after 1.5 years of COVID-19, don't have multiple test centers on arrival for customers to choose other than one? That feed into the myth of the test result not being accurate and being contested by the day. What do you say about that, Doc? I'm sorry, you are
thank you very much.
A doctor of med, whatever, and you are only a presidential advisor, so I don't want to put you into politics. Forgive me. But this is very passionate to some of us here.
Thank you very much, Emmanuel. This is a very good. I would like to get the various tests that you did. You see, the most important thing is that these are PCR tests.
I did one in Omni and one in Leiden on the same day.
And
they are all PCR tests, and I paid 500 Ghana cedis.
Yeah, that's what I said. They are PCR tests. And that's what you remember when I was making my presentation. I said the different tests have different techniques. PCR test requires that anybody who is doing the PCR test should be well trained. Because PCR test has a lot of subjectivity attached to it, because you have to get the viral load. You know about that. And depending upon what the person gets, and there is both qualitative and quantitative. So if somebody does this test, especially the same day, that you do one test and another person says negative and the one says positive, it's very worrying. And these are some of the things that some of us say that if you are doing all these things, you should make sure that quality controls are also there. I know that the Food and Drugs Authority and other people who do the quality control goes around doing quality controls. We have stories of some of the testing sites which have a problem of quality at times, which they go in. So we would like to have a look at it and they'll go into their systems, because normally some of the tests, this is May, so maybe they've thrown them away, but that's how it is. And it's in May this year, isn't it? So we will have a look at it.
Well, it's actually this year, April this year, okay. May this year.
Yeah, so
I've not been to Ghana again. And
yeah, it's very,
my experience is such grave that
I know.
I'm
Even
telling
if,
you honestly,
if
I'm
if
not.
I'm the
Can you
one,
imagine the chairman of Ghana Union going on social media and broadcasting to Ghanaian community about what his experience, how much attraction that would be?
I agree.
I decided to keep it.
Emmanuel, I agree with you. I agree with you that so we have to look at it and see. There are a lot of now lab companies which have come out, and there are multiple of them, especially doing PCR tests and doing even this type of test that we are having at the airport. Now there are about 4 or so of them also in country. Leading that we are talking about has that type of test also being done elsewhere. But once in a while we see some of these issues coming up, which we subject it through Food and Drugs Authority to investigations when we get to know about it. See, the worst of it all is that I think we all heard where somebody went to one of our very renowned laboratories. He had a positive test, and somebody said, bring 500,000 Ghana cedis or 500 Ghana cedis, and it will change to negative and all sorts of things. So we know all about all these things, and it's in the system. People are trying to make money out of whatever is happening. The competency of somebody who is doing the test, which is supposed to be controlled and then monitored by a senior experienced person, all should be done, and then we will take action about it. So when you finish, send it to me by email with all the names there, and then we'll check how it is. And we ask a very important question: why is it that this is the departing? Why is it that arrival we don't have more than one district? Yes, as we said initially, there was this arrangement which was done with a vendor. The vendor has done all the necessary infrastructure and everything there. And we all know that this arrival testing, I can assure you that it won't go on forever. Even PCR testing may be years later on, when the virus, the pandemic goes down. I'm sure once in a while, maybe winter time or something, somebody will say that you need it like other tests before you travel, or you need a flu test before you travel or something, especially when a lot of people have been immunized. So we have to look at all these things and then make changes. Anything that we have done is not static. It's the dynamic system that we are running. And everybody, including the president and everybody, is also looking at the cost. We are looking at all these things. They've charged that we sit down with the vendor again and look at the dynamics again and see how much money he has made so far. We look at how much investment that he made, and then we track an average and then sit down with him around a table and then look at it. But at the airport, that's how it is. We are about to open the land borders. We do the same thing to the land borders. And the feeling around is that allow a lot of people to go freely and go and set up. But once we do this, we have to also make sure what you are saying comes in, so that we have control measures in place. That people say, oh, if you go to this side, you get negative. If you don't take, that's what will happen. If you go to this place, you get positive. If you don't pay to me, I'll make you positive. And then when you pay to me, I'll make you negative. There are bad nurses in the system. There are people who have to continuously be training and retraining, and then also be professional, and then be courteous of everybody. But competition brings also a lot of things, very good things in place. So we take all these things on. And then
Doc. Thank you, Doc. But I'm sure you understand why we don't question the integrity of results in UK and other countries. Because when I returned to UK and I got a negative test on day 2 and then negative test on day 8, I have no reason to surprise. But when I'm in Ghana, between the 29th to the 3rd, to the 19th of May, I did almost 40,000 Ghana cedis worth of tests just to get out. So imagine you're into Ghana with your pocket money finished and you are now going through that. It is a frustration. And some of us may not go public because we don't want to encourage others to take any WhatsApp message to just broadcast it. But it is a concern for us. So please, I'm pleading with you. As you move from tonight's event, please speak to the president to look at some of these issues for us because it's dear to our heart. Anyway, I'll move on from my personal experience. Now, I'll go Christian's iPhone so that they can ask their question. Christian, also, can I ask Doc, do you have 30 minutes for us? Because we are now going past our time. And there are still questions to you.
I'm at your service.
Thank you. For the first time, we are having an extended version of Community Awareness Forum because of the nature of what we are discussing. Doctor has agreed for 30 minutes. Those who want to stay can stay. Those who want to go can go. But there are questions I want to go through from those who have raised their hands up. Equia Mavis. Equia Mavis.
Hello, Mr. Quayson.
Please go ahead.
Good evening. And I just want to say thank you to the doctor for taking the time to explain some of the things. But
I don't know whether you muted yourself or your line is gone off, but we can't hear you anymore. I'll come back to you if you come back again. Reverend Augustine Anani. Oh,
Mr. Quayson.
Sorry. Please go ahead. Go ahead, please.
No, that's from Christian's iPhone.
Well, okay, you go ahead.
Yes, yeah, I don't know whether doctor missed answering some of the questions deliberately or not, but a notable one is the psychologist who is apparently at the airport to sort of help people who happen to test positive. If he could throw light on it, because I mean, if I should test positive at the airport and then my passport gets seized and then I have to go to a psychologist for any kind of support, I don't know whether anything that they are going to say to me is going to have an impact of any sort. So if you can throw more light on that, I think that will be helpful. But otherwise, I have just returned from Ghana, and I must say that all in all, generally, a lot of the staff and everything put together is really great. And I think we must commend the people when they are doing the right thing, and they must also take time to listen to us when we are sort of criticizing them, because all in all, that makes them sit up and do the work well. Because coming back, there are so many staff at the airport who help you through all the paperwork, which you don't get in other places. So I think that is a very good thing happening at the airport. So they should take their time. They cannot just simply say those abroad are always criticizing because they think they are abroad. We have genuine concerns, like you have rightly raised. How can you test positive and negative on the same day, for instance? So they should take time and listen. It's not like people are outside, so they are being all-knowing and that kind of thing. Please listen to us, because like I'm saying, I am all for commending for the good job they are doing at the airport, but then listen to us as well when we have concerns. Thank you.
Thank you. I'll add to what you're saying, that looking at where Ghana is now around the world, they are doing a sterling job. Yeah. Albeit with very difficulties. We understand that. And that is why we don't make noise when there is a need to. So we are here to support Doctor and his team of COVID-19 task force so they can understand the diaspora view of what is going on. So thank you for your comment. I'll add one more question. Augustine, please. Reverend Augustine Anani, if you can add your question so Doctor can answer them. We've got 30 minutes to finish. 20 actually left.
Yes, thank you very much. I am still concerned about the fact that if I have had a double jab, I have proof of it, and also 72 hours before arrival at Kotoka, I've done my PCR with a negative test, and I still have to pay $50 as a Ghanaian passport holder to do another test there. I am very concerned about that. The second question is, if after 1 year, the government can still not support Noguchi to also rake in some of the benefits of the fees of the testing by doing it themselves, and everything is going to outsiders and private people, whereas we could have got money to also improve on Noguchi, that is also a concern to some of us, that the government is not looking at the ways to benefit the government institutions, but rather it is private people. And these are even other nationals from other countries. That is some of the concerns some of us have in the diaspora.
Thank you.
Thank you.
Thank you, Rev. Thank you. Doc, I'm going to add Akuya May because she was already on before her line went off. She's now at the back of the queue, and I'm going to call her to finish what she was saying. Akuya, please, if you want to add to Doc's questions.
Yes, thank you very much, Mr. Quayson, and thank you very much, Doctor. And what I wanted to say was probably just some feedback to Doctor, really. And I think when I raised my hand, I think as the conversation went along, Mr. Quayson, with you sharing your experience, Doctor, respectfully, was able to actually accept that there are some challenges and that for us in the diaspora, we can actually voice our thoughts about it. Because prior to that, Doctor, it seemed as if you came across as if you're not happy with something happening in Ghana, we cannot give any negative feedback whatsoever. You've used language such as nobody should downplay what we do in a sovereign country. We are all citizens from that sovereign country. So I don't think any of us would seriously want to say anything publicly that will be detrimental to how Ghana is viewed. So when we do share our concerns about what is happening, they are genuine concerns, and it doesn't reflect very nicely on us in a diaspora when we want to share something which is negative and we're seen as those people from the outside coming in to come and insult. Okay, the lady that came on social media, it was true that she probably went too far. We all agree with that, but that doesn't mean everybody. My final point I'd like to make is in the UK, they have reduced the cost to international arrivals for the test. Also, if you don't want people to run away or abscond, then maybe the government should be doing more with regards to the controls they have around when people are asked to isolate. You are not detaining people, you are isolating people. If it's written into statute, then please let me know that it is law that when I get to Ghana, so this and that, it is written into law. Because in the UK, some of the rules we had to follow had to be written into law and had to go to Parliament before we had to. Other ones were advice. So with all due respect, I respect your profession. I respect who you are. But please, some of us in the diaspora are of the same level as you. And when we do come with our feedback, we do ask that Ghanaians in Ghana also respect us in the diaspora who give our feedback. That's my point made. Thank you very much.
Thank you, Kia. Doc, please address the issues that you have at hand on those three people.
Yeah, thank you very much. Yes, the psychologists are there. There are clinical psychologists who are there who normally talk to people. I agree that we are learning and we are improving the systems there, and we want to make sure that everybody who comes there, comes there and then you go home or you go for isolation, you have to go through a system. What happens is that we are trying to streamline the way that even the positive cases are being divulged to the passengers. Because it's not good, we are positive. Some people do that. So we are learning from every day. And the clinical psychologist is stationed at where the sorting out is done. That is, there's a room just before you get out. So if anything happens and maybe somebody is being handled outside there for one reason or the other, we look at it and then solve the problem. About testing after your 2 jabs and then coming to test again for 72 hours PCR testing again. As I said, yes, we are reviewing, we are continuously reviewing all what we have been doing, the protocols. But as at now, we haven't taken any firm decision what to do with those who have got through 2 jabs before coming to Ghana. I'm sure very soon we all do that. But as I said, there are a lot of vulnerable people in the group which can even infect you, even if you have double jab. The fact that you have double jab doesn't mean that you cannot be infected by the virus, only that you cannot get very sick or die. So continuously, Reverend, we are reviewing whatever we have. And the Reverend was asking why government doesn't allow Noguchi to do the test and all this. Noguchi is a research lab. We actually want Noguchi Noguchi came into the testing. Normally, Noguchi doesn't do these tests. He came into the testing because we didn't have that facility. Once you have a lot of facilities going on, Noguchi, so far as we are concerned, should be restricted and do their research and do the lab tests that they are supposed to do to confirm. So I still insist that yes, the private sector, if you go outside, when you are going, you are departing. There are a lot of tests which are being done outside there. They are all private sector. And the private sector will be encouraged to take up and they also do these tests as much as possible. So we work hand in hand with the private sector. Government will make sure that they will do what their core business is. The private sector will continue doing what. Akuya, who spoke last, I'm a very respectful person, and there was no way I was disrespecting anybody. But she herself also accepted. I think the person who asked the question was referring to the lady who was very insulting, and she agreed. And that's what I'm saying, that we will not accept such insult from anybody. Doesn't matter where the person is coming from. But we accept and take any criticisms in good faith. It's criticisms that help us also to make sure that we are going in the right way. Because the saying is that when you are on the path, you don't know what your path is. Somebody looks at it and tells you. So there's no way that you are respecting anybody. Any views which come, we accept it and use it to work off. So please, if I say something that you think I'm being disrespectful, no, I don't. I'm not somebody who disrespects anybody. So your views are welcome. We all have to help and then do these things and do it properly. And that's the reason why we listen to everybody. And we don't want to say that, oh, this one has said this, we won't take it. There's a tree saying, some obi odi actually no never say be a customer. So please, if I said anything which maybe was not very palatable to you, I was just trying to answer the question about people who are taking tests and then going around and say there's this and there's this, but genuine criticism, very concrete criticisms, we accept it. So I'm sorry if that is maybe the way you took it. And I'm very respectful. I respect even people who are working with and everybody. Thank you.
Thank you, Doc. And before everybody joined, I did say to Doc, he's one of the most easier person to deal with in my time of holding this forum 12 times now since February this year. He answers, he responds, and he gives details. And I'm not saying this to back whatever is going on, but all I'm saying is, if we can get people like him to attend to our questions every 2 weeks, we will be in a better place. Because there are some people who hold high offices that you can never reach them to even let alone question them. Doc, we are grateful for the answers. And I'm sure you understand that some of these has emotions to it. I am emotionally torn, but who am I to express it? And that is why I shared with him so that he doesn't make it look like I brought some WhatsApp message that I'm showing him. This is my experience. And that is what it is. And others will have similar experiences while in Ghana. I am now frightened to travel to Ghana because I don't want to go and get stuck another 2 months. And that is what it is. So we'll move on. There are chat room questions. We've got 10 minutes to finish. I've got Jemima, please, because VY, I called you already. I'll move on to somebody else. I'll come back to you if there's more time. Jemima, please. We still have Jemima with us?
Yes, I'm here, Emmanuel. Thank you very much for the opportunity. And thank you, Doc, for all the explanations that you've given to us this evening. I just want to reassure you that we in this area, in the diaspora, are not taking for granted what Ghana has done so far in protecting the citizens. I boast myself with my colleagues. I'm a registered nurse. I qualified in Ghana in the very early 80s. So you can imagine, and I'm here and I've done so many things that I have, improved myself on. Let me also assure you that I was in Ghana in February. Voluntarily, I live very far. but I drove to some of the government centers that are testing COVID because I have been trained to even train people to test for COVID infections. So it's not that sometimes when we are here and we come, we think that we know too much or we know better than those in Ghana. We are not, taking their experiences for granted at all. I just wanted to reiterate the fact that just to get some of them in the airport doing this testing, refresh themselves from time to time to be able to do the right things, because I have had an experience and I'm not going to say it here. I'm coming again very, very soon, 2-3 weeks time. And I hope that I wouldn't have such an experience again. But just to reassure you, we appreciate what the Ghana government has done so far. Ghana was the first country that was to establish this
all right.
testing.
Can you please go to a question or suggestion so that we don't delay because we've got a few minutes? Thank you.
The suggestion is to just get the testing staff refresh their skills from time to time. Thank you.
Thank you. So she's only asking that those who are in the position to test and trace are refreshed so that we don't find ourselves questioning their work. That's one thing. Comfort, please, comfort. Comfort, if you are still with us, unmute yourself and tell us what you have in your mind, please.
Right. Thank you very much. I'm using my wife's system.
All right, Mr. Comfort, go ahead.
Thank you. Thank you very much, Tony. And thank you, Chairman. Some of the comments I think are not very fair. About the last one, which talks about the experience or the expertise of people taking their samples. I've just arrived from Ghana. I've been in the UK for about 3 weeks now. I've been to Germany and back, and I have done about 6 tests. In the UK, I've spent close to £300 on tests alone, and some of them inconclusive. I've been to Luton drive-through test sites. The expertise of the people taking the samples are horrible. I had to tell them that I'm a health person and the way you are taking the sample is not right. And the things came out inconclusive. I had to go for repeat tests. These are things that are also happening in the UK. So it's not only in Ghana that you may have challenges. There are also challenges in the UK. The private sector is the people who are taking the money for tests. You can't use an NHS test to travel, and you know it. In Germany, I went to Germany, coming back, my test was for free because I went to a public system and they allowed me to travel in here. So all the countries have different rules to govern this pandemic. This pandemic has come, and I know that you know in the UK that people are making money, a lot of millions out of this thing. In Ghana, this is not the case. It's one company that does that. When you go into the PCI, there are several other companies, including private sector, including Noguchi, that does that. So the thing is well spread, and I don't think that you only need to look at the negative sides of the experiences in Ghana.
Thank you. Thank you.
Please.
Thank you, and that is very important. That I'm not going to allow Doctor to even add that to his answers because that is very important. We have a country that is sovereign. We are all part of that country, whether distant or near, and we hold that country to our hearts, and that is why this program is being hosted. 2.5 hours of doctors sitting here, all of us on the platform. It means that we care. So the reason why some of us don't even go public is because we want to follow the process and make sure the process works. Okay, so we understand when you come to UK and you test positive, it is positive. There's no argument about that. Nobody can go to call any minister and say, I'm your brother or I'm your sister or anything. Doctor is here because he is a public health advisor, not a politician, I believe. He's advising the president on public health. And that is why his role is very important. Let's take anything out. He's a medical officer. He knows what he's talking about. And therefore, we understand where he comes from. So let us all appreciate what we have, help it to work. There is always flaws in the system everywhere you go. And therefore, we all appreciate the work that they are doing. Thank you for your contribution. I'm going to add one more before Doc answers anything. Sam, please, Sam. Do we have Sam with us still?
Yeah, you are with me. I'm with
Please
you.
go ahead quickly and brief.
Can you hear me?
Yes, we can
Hello?
hear you loud. Yes.
Okay. Thank you very much for putting this program together. My simple question is that we've been hearing, even though we are Ghanaians, we've been hearing Chinese whispers that a nearby country has been reaping all this money. And I don't want to mention the country. I want our honorable doctor to throw light on that, whether the money is going to Ghana or a country we know, we've been hearing is reaping the money.
Thank you. Somebody has just answered in the chat room that the company is a Nigerian company. I don't know if the doctor can confirm that. Doc, please go ahead.
Yes, yes.
Yeah, thank you very much. Yes, the company is not a Nigerian company. The company is registered in Ghana. So it's a Ghanaian company. Maybe the CEO or somebody who is doing this is a Nigerian. Doesn't make it a Nigerian company. The company which is doing it, as I said, has about 350 Ghanaians who are working there. So I said something from the beginning. Everybody wants to know about the costs, but the value, people don't look at it. And as I said, at the departure hall, because a lot of people have, at the time that we started doing the people who are departing, that we want to increase the number of people who are testing. If you go there are a lot of people who are testing there. There are also companies who are Ghanaian companies, but the owners, people who are leading it, some of them are not Ghanaians. So far as some of us are concerned, we want a test to be done. And at that time that we needed the test to be done, that is the vendor who came out with what we needed and what is supposed to be used as quickly as possible. So not that is company and somebody is raking the money and going somewhere. I don't know about that. What I know is that the test is being done. So let's look at what is being done there, the value of it, and if it is being done very well to limit the importation of the virus in this country. If it is not, if we're not doing anything at all at the airport, by now I'm sure we'll have a lot of cases and a lot of deaths on us. So that's the first. The second one is the comment from a friend. I'm sure he knows me, maybe I know him also. Yes, continuous quality improvement. You continue doing continuous quality improvement, listen to people from outside and anybody who will give ideas how to improve the system. And then the lady, the nurse also was talking about retraining and refreshing the people who are working there. That is something that is ongoing. And there's now a team of what you call the laboratory coordination team, which goes around making sure that people are well trained and continuously to be trained. So that is also being done to improve the system of the testing in general in Ghana, so that we don't have the problem that some people go through.
Thank you. I have someone who said they are disappointed because I haven't called them to ask their question, but what they want to say is, how much has Ghana government made out of the testing since it was implemented? They are quoting a tune of $16 million. How much was made by the government from the COVID testing last year out of 16,000 allegedly made? 16 million, if I would say, sorry, my apologies. Look, this is not your area. You are not.
I don't understand that question very well.
It's from the chat room. How much was made by the government from the COVID testing last year out of 16 million allegedly made? You don't have to answer this because this is an accounting issue. You are a medical professional. I don't want you to delve into something you have no figures on. If you can, I'll be great.
Let's look at the value of whatever is going on. So I think let us look at what is happening at the airport. Is it of value or is it not of value? I don't know where they get their 16 million from, because I explained, I'm sure the person took the number of passengers who have passed through there, multiplied it, and you should know that not everybody pays. Children, I think below the age of 12 don't pay anything. So you should do all these things, and then how much tax goes to the government, how many people are being employed, how much are they paid, and all sorts of things. And as I said, we are continuously talking, we are continuously dealing with the vendor to make sure that everybody who passes there is very comfortable, and then the cost and everything is come down. That's all what you are trying to do.
Thank you.
So let's look at the value and then compare it to the cost.
Thank you, Doc. I think that's good enough. One question from me before I add two more, then we'll round up. How many of these vaccines has actually been bought by the government? Because some of us listening to fellow Ghanaians broadcast, we were promised that by March this year, 20 million vaccines would have been bought by Ghana government. But it would have appeared to us now that everything coming in is a gift aid from overseas and other, as some of them you highlighted, from German, UK, US. How many has actually Ghana government itself bought and used for the citizens of Ghana without the gift aid and other donations? The ones that we want to know is how much has Ghana government itself paid for from its financial budget towards the pandemic?
Yes, Ghana government has committed and paid some deposits and buying Johnson & Johnson of 17 million doses. That means that Johnson & Johnson is one dose. So it's for 17 million people. So the majority of the vaccines, which will be used for the target of 20 million, will be vaccines that Ghana government is going to buy or has bought. Because you commit yourself and they pay for it as it comes. And the Johnson & Johnson has started coming into the country. But so far, majority of the vaccines which have come are from COVAX or from African Union through COVAX. So the majority of the vaccines that we are expecting by the end of the year or early quarter of next year is what Ghana government is buying for its population.
Right. Okay. Thank you, Doc. Someone is asking if I can ask you, would you be happy to reappear at some point so that we can engage with you? Because as you can imagine, we are not some old people here. We want to come home, but we are being threatened by some of these issues. So it's good to have someone like you who can explain some of these things. Would you be happy to reappear, or you've been put off by some of the questions?
No, I like those questions. I like the challenges. And I'm at your service. Anytime you call me, I'll come. Because truly, I've also been a diasporian before. So I did my postgraduate education outside. I came home. And I think that's the way that every country develops. So we are ready, and I'm very ready to discuss and dialogue with you and judge with you so that we can improve the health service of this country. My dream is that we have a health service in the country which is similar to any other health service in the developed countries. Because I've seen systems work. And I want to make sure that the systems in Ghana also work. So any views listen. So anytime you call me, I'm ready to, because it's virtual. It's not that it's personal, person to person. So anytime you call me and you want me to join you to answer questions, I enjoy difficult questions. So we bring all the difficult questions and we try to answer them for the benefit of all of us, to improve the system. That's the most important.
Thank you, Doc. Honestly, I think tonight has been so much engaging. I am more at peace with myself, having shown you whatever. I'm sure others have been. There are about 3 or 4 questions, but before then, I will give you a few seconds to take a break. I know we are 9:35. We will round up soon, Doc. And I'm grateful for the extra time you're giving me. Nobody has done that. Thank you. We'll round up a quick advert from our sponsors and also mentioning the fact that this program has been put together by World Remit, sponsoring us, and obviously the other partners involved, which I'll mention them soon.
World Remit helped me give you the best start in life. Even if I couldn't be there to see it, I know it wasn't easy comparing yourself to your friends, but the money I sent home meant that you could be right there alongside them today. I'm so proud to be your mother, almost as proud as you must be now that you're starting an incredible new chapter.
This program is brought to you by World Remit, a fast, reliable and better way to send money.
Apologies, I'm muted. Thank you for coming back. And World Remit has been the reason why we can continue to host you and educate and inform and make you aware of what is going on. Thank you very much. Ghana Nurses Association UK, Western Region Nurses Association UK, Ghana Union UK and Ireland, and Nightingale Nurses. We are grateful for your partnership, and we thank Omega Live for carrying this live on YouTube, Facebook, and other social media channels. Welcome back. A few questions before I go to the roundup. Please, I'm going to ask 2 questions from Salasi, please. The Celsi Mawutu, and then Mamiya Bosumpe, and then we'll finish with those one. I'll call Ivy as well. 3 of them, that's it. Then I will round up. Thank you very much. So first of all, Celsi Mawutu, if you are there with iPhone, if I've mentioned your name wrongly, please forgive me. It's what it is. Salasi, please.
Yes. Have I unmuted myself now?
We can hear you, yes. Go ahead.
Oh, yeah. Well, all said and done, I just want to say a big thank you to Doctor. Unfortunately, some of us might have had a very awkward experience with our nation, but I just want to say, for me, I equal to Ghana, because me talking to you right now, I am a proud Ghanaian telling people they should go to Ghana and learn, because in every situation in life, you know, some might like it, some might not like it, but doctor, don't give up on your protocols that you have put in place for Ghanaians. The issues about COVID and all that, then this is a private company, this is, in England here, it's all private company. Nobody accepts NHS, PCR or whatever. You go and pay. But you see, we are in a developed country, so-called. But Africa, we know that we are in the 3rd world country. But Ghana has proved himself that even though we are a developing country, God has given us brain to protect, use our brain to protect our citizens. See how many people we've lost in the developed countries? And compare it to Ghana, how many people? So if there is, in every situation, you cannot get everything 100%. So what Ghana has done is not about this party or politics or whatever, but what Ghana has done had really placed a value on we citizens of Ghana. So we should be proud, we should back our government, whoever is there, to know that if Ghana did not take the step that they've taken in that airport and the way they shut everywhere and help our citizens, can we even stand the graves? Can we have ground to bury our citizens? So at least we should be proud that we can stand to call ourselves Ghanaians. I tell people, I live in London. I tell them, listen, go back to Ghana.
Thank you very much. I think we've noted your point. We are all Ghanaian. We cherish Ghana. We love Ghana, and that is why this program, first of all, was put in place. We want to make sure that we are also aware of how to go about some of the issues that we have become aware of. We understand where you are coming from. We appreciate your contribution, obviously. We are all here to help Mother Ghana. No question or answers given here is not in the interest of Ghana. We are all diasporans. We travel in and out of Ghana, and therefore we understand that when things are okay, it's good for all of us. And we are not here to banish Ghana on anything. And Doctor has volunteered almost 2.5 to 3 hours to give us the information. So we are grateful. Ghana has done exceedingly well compared to other African nationals. We are aware of that. The history of COVID and who has done well or good or bad, we are all aware. It's a public domain. Nobody can hide it. We thank you. And we'll move on to the next one called VY, please.
Thank you very much. Thank you very much for allowing me this time. I want to correct one thing. So both of you have done very well in hosting this program. The question about passport. No one, and I repeat, has the right to withhold somebody's passport. So that's a fact. So I encourage the doctor to check with the right authorities. The second point I wanted to make is this. Ghana is obviously a developing country. We're doing very well, but we have to listen to the rest of the world. Just today in UK, the amount has been reduced. This is something that has been discussed for a while. So Ghana can't just stand still and wait and then say we are discussing. Yeah, that $150 that you charge people coming to the country, we're promoting Ghana, should be addressed now. It shouldn't be a thing that you wait for other countries to make a decision. It should be discussed now. Even UK is reduced the price. If somebody's had a double jab, what is the need to have a PCR test in Ghana?
Thank you. I think your point is made that Ghana needs to address the issue of PCR test now that UK, but let's remember, UK may have relaxed its rules. It doesn't mean Canada too have done the same, or Germany or United States. So Ghana is within its right accordingly to make sure that everybody else is safe. So UK may have done so, other nationals may not have done that. So let's not put the burden and onus on Ghana to relax UK alone, because they are dealing with international community. Doctor may add to it if he so have something to add to what I've said. But I believe that as UK have done so, if other countries will follow suit, it will make it easier for Ghana to hopefully review it. Until then, as you're traveling to Ghana, the law is you follow the protocols. When you are coming to UK, then you know you are free. You don't need to do no test, and no airline will stop you from boarding BA or wherever. However, you need to also understand that if you do a transit flight to KLM, Amsterdam, Belgium, or France, they will also have their own rules. So let's not take UK's relaxation as something that is a universal thing. We need to be aware of that. Doc, please go ahead, and I'll have one more question before we close.
Yeah, thank you very much. I think you said it all. We are happy that UK is relaxing its rules, and Ghana is learning. We also look at whatever other countries are doing. That's why I say that we learn from our own data, and we learn also from the science of whatever is happening. So as I said, the protocols are not written in that you cannot change the protocol. It's dynamic. So we continue also looking at what the other parts of the world are doing, what is happening around us. And globally, we all want to get out of this pandemic as quickly as possible. Thank you.
Doc, thank you. I'll call one last person and I'll give you one more question from the pre-received questions, then we are done. Mamiya Busubuchi, please.
Thank you very much, Mr. Moderator, and good evening, Dr. Nsiah-Sarri. It's a pleasure to see you here doing what you do best from the days of Navrongo Health Research Center. Really good to see you here. You know, I just want to just make a comment globally with regards to this pandemic. This is a historic, unanticipated event that has happened, and the world is evolving and learning from this. A lot of us are public health officials who were trained to react and help our communities in times like this. However, the world has also really changed in terms of information sharing. And right now, as we see everybody giving their opinions, the opinions and practices of public health professionals is somehow not even being regarded. It's almost like when the World Cup starts and everybody becomes an expert in coaching. I just would like to just state that the world has been brought to its knees, and our professionals are doing their best to also address the needs as we have it, and we're learning from it. It will be good for us to also realize that what we are seeing happening every day right now with regards to this pandemic is what health professionals are doing every day before this pandemic happened. When it comes to accessibility to medicines, they are negotiating every day for prices to be reduced in different countries and populations. And that's what we're seeing right now. Maybe the UK is able to reduce its pricing because they're able to negotiate at the table with the different companies that are producing all these facilities. So I just want to say, you know, kudos to our professionals, knowing that they are responding to this pandemic as we are seeing it evolve, and that for the general public, we appreciate the learnings that we're getting from this, but we have to not forget about this historic moment and know that when this pandemic is over, we need to look at maintaining a strong health system so that in the event where the next pandemic happens, we will not all be at our knees as the world was brought to. So Dr. Nsiah-Sarri, Ayuko, and it's good to be connected to you again.
Thank you.
Thank you very much. Doc, go ahead. Thank you.
Yeah, thank you, Nanaya. And I'm happy to reconnect again with you. I hope that you continue giving us your opinion and whatever you learn so that you make the system better here. So
thank you. And thank you, Doc, for your consideration. We promised 2 hours. We have now lasted 2 hours, 49 minutes. I don't want to give commentary on time, but people have enjoyed it. I have 2 more questions, but before I do that, let's show the next program. 2 weeks from today, we'll be talking about other things which I believe is quite equally important. 2 weeks from today, on the 1st of October, same time at 7 p.m. UK, 6 p.m. Ghana time, we will look at wealth management. Impact of COVID-19 psychosocial impacts. Some of them include wealth management, investment in the UK, trust, how you put your investment in trust, your pensions, your mortgages, and protections for your investment. Some of us, for whatever cultural barriers, we don't do any of this, wills and other things. And I encourage all of you to make efforts to come and join us. We will have key experts from Alex McIntyre is a chartered financial planner, executive of Fortune Financial Services at St. James's Place, and Betty Hammond, Vice President of Ganesta. These are well-versed people who can show you what you need to know in this pandemic, in this situation that we've all been in, and how you can protect some of the things that you have worked so hard for. So please, 2 weeks from today, join us, share this, let others know so that they can become part of benefiting from it. Thank you very much. Doc, we will come back to you with 2 more questions and you'll be done for the rest of your evening. Thank you very much. The next question I want to ask is, how much do you know of Ghanaians who hold Ghana passport issued outside Accra are being asked to pay $150 for the test rather than $50, sorry. I, as a chairman of Ghana Union, I've had 2, 3, 4, 5, 10 people telling me that when they get to Ghana, because their passport was issued in UK, they are being told to pay $150. How much of that do you know, please, in your capacity as advisor to the president? Secondly, why are travelers, sorry, no, this is not the one. Do you agree with those who believe that the system in Ghana is open to abuse towards making money from travelers due to series of irregularities that has not been monitored or identified by the authorities? Would you agree? And you don't have to agree, but in the light of what you have experienced from us today, do you think the system as it is, without any regular monitoring, testing all over the place on departure, outside your remit, arrival at airport, only one company being designated to do without any choice to a customer as to what they can choose? Do you agree that it can be subject to abuse by others who will take advantage of vulnerable people like us who don't know left and right when we arrive? And yes, those 2 questions, please.
Yeah, thank you very much. I'm not aware of Ghanaians who are holding Ghanaian passports but from outside who are asked to pay more than the $50. I think people don't pay money now, maybe before. Nobody pays money at the airport. You only show the receipt that you have paid. The money is paid before you embark on your trip. So maybe it was just maybe in the initial stage, but I know that once you put in your Ghanaian passport and you are paying, you don't put where you took the passport from because all digitized. So that I'm sure if it was happening before, where you show your passport and then somebody will just, maybe that's one of the abuses that we are talking about. It's a need of monitoring all this. Somebody at the airport said, no. Because we know that if you're holding a Ghanaian passport, it's $50. If you're holding any ECOWAS passport, it's $50. It doesn't matter where the ECOWAS passport is coming from. So I don't believe it's happening now. I will check and see what it is. I don't know. I haven't heard it before. The second one is abuse. Yes, every system that you put in place, it's normally, if you don't monitor it very strictly and monitor it regularly, it will be subject to abuse. So we are aware of that, and that's the reason why, as I said, we have what you call the lab coordination team, which is made up of people. It's headed by somebody, a professor who was in Noguchi. He has a national lab coordination team. And the most important thing even about the laboratory testing is not doing the tests. It's doing the tests and capturing the tests on our database. There are some of the labs who do the tests and will never capture the tests on the laboratory database. And that's a concern to us. There are sanctions to all these things. We can be accredited lab when the need be. In fact, what you told us, your story like this, we will investigate it. If you investigate it and it's something that is listening, we can ask the lab to stop testing. And as Ghana Health Service and the Ministry of Health have that right, because every lab in the country signs a memorandum of understanding with the Ministry of Health through Ghana Health Service. And Ghana Health Service they have sanctions to it. If you misbehave and you are not doing the right things, you are just making money, your lab can be de-accredited. HIFRA, which is the Health Facility Regulatory Authority, can also come and close any lab if the lab is not working well. So we have put in systems in place, and the systems have to make sure that they are continuously and constantly also making sure that people are doing the right thing. For the arrival, that's why people have it, as you have a choice. But the problem is that because what we did from the beginning was we wanted to have a good infrastructure in place, a robust infrastructure in place where we can do the test. As I've already said, the testing we are doing, when we started the tests, we all knew that it wouldn't go more than a year, because we knew vaccines are coming. We also knew that the virus has gone through 2 waves or so, and then when it goes around the whole of the 5 continents in the world, then it will be like Ebola or any other virus, which the pandemic will go down. But it's not, doesn't seem to be this way. That's the reason why we've gone on up to this time. But I can assure you, as I said, we are reviewing the protocols from day to day. If a majority of the people who are coming in, especially those who have had 2 jabs and they are negative, and they have negative PCR test for 72 hours, there's a lot of conversation going on. Do you have to? Somebody asked that question. So we are discussing all those things. But the question which comes in is that we have a lot of vulnerable people in the system, because a lot of Ghanaians are not vaccinated yet. And most of the people who are coming first, the first point of entry or the first point of contact is in the hotspots, Accra, and then most of them move to Kumasi and the other big cities. And that's where we're having a lot of vulnerable people. And that's where we're having a lot of people catching the virus and the disease and getting sick. So the question is, do you allow people to go in? Because somebody who is also has 2 jabs and PCR negative, if the test was done within 48 hours, is incubating the virus and is exhibiting it, he will not be sick, but he can infect someone. Initially, all those who were getting sick, most of them were asymptomatic, but they were infecting people. And especially we became a bit scared and everybody became alarmed that you relax all these protocols at the time that we are in the 3rd wave, at the time where the whole world is now trying to have a hand or a stamp on the Delta virus, a Delta variant and a Delta plus variant, which was very deadly. So we said, no, if we want to do anything, let's study it for some time. Let's look at the system. Let's look at what is happening in the rest of the world before we take a move. Because no Ghanaian will forgive us. The scientific society will not forgive us. Our professionals, who are the frontliners, who are the forefront, are the people who have been telling us, don't relax any protocols you've put in place, because they bear the brunt of all this illness. The number of health professionals who have gotten sick, the number who have lost their lives, we wish there are no health professional loses his or her life, but we lost some lives because they come in contact with the patients the first time, and irrespective of whether the person is vaccinated or not, he can be sick. And who knows if the person has underlying illness? Then before you realize, he's either in the ICU, so the ventilator, or he's dead. And the most important thing that everybody is also grappling with throughout the world, it's a global issue, is even the post-COVID syndrome. What happens to people after COVID? There are a lot of people who have COVID and they have lung fibrosis. Some of them cannot breathe well, they get tired easily. I know somebody who was not a diabetic, but immediately had COVID. Yeah, he's now on insulin, high doses of insulin. He's a diabetic, a young person. So these are some of the things that we want to put all in place and make sure that anything that you do, any protocols you bring in place, will also be in line with whatever the scientific world is saying, and to be in line with whatever our conditions in countries. Because UK can afford to do all these things because they vaccinated about 70% of the population. America is even going back onto their restrictions because they are having problems, because there are areas where they have not been vaccinated. The young ones are getting sick and dying. So these are some of the things that we are doing. I'm very happy that some people have also seen the good work that you are doing in this country. We always pride ourselves that even within the African sub-region, we are not different from all the other countries in Africa, Kenya, South Africa, Senegal, Liberia, where people are dying, Nigeria and everywhere. But Ghana, at least we have one of the lowest mortality in the whole world globally, 0.85% of the population. We have been hovering around that, even though we believe that we shouldn't have had about 1,000, nearly 1,200 deaths, but we have them. We wish nobody died. So please, just continuously be bearing of us, continuously give us your ideas, work together with you to make Ghana a better place, to make our health system work well. Thank you very much.
Thank you, Doc. It's been a pleasure having you, and I'm glad that you have answered questions, albeit some being a bit emotionally or tensed. We did not draw politics into this. You have done so with professionalism and all the good that you have to give us. I believe that we have a lot to do with you going forward. You'll be good. We don't know how long COVID will last, but it'll be good if we can have an interaction with you at least once a quarter, so you can have this kind of update, because we've lagged this for 1.5 years now. Since the border was opened 1st September 2020, this is the first time any official from Ghana government is talking to us about what is going on, and we appreciate your time. Thank you for your time. Thank you for the extended hour you've given us. We are grateful. Thank you to the audience for staying true and sharing your ideas. We will revisit some of these areas in due course as time may allow and as things progress. I also want to thank World Remit for their support to this program. I want to thank Ghana Nurses Association, Western Nurses Association, and Nightingale Nurses Association, and of course, Ghana Union for putting this together. I want to thank those who we don't normally see, Paul Akwabwa, Linda Wayo, and Lilian Osei, who are holding this behind the scenes to bring us this program. And of course, nobody thanks me, but I will thank myself for hosting it. Thank you. Doc, it's nice to have you, and we wish you Godspeed in your work, and we look forward to see you again. This is all time will bring us to deliver this program. We thank you all for coming, and until we meet in 2 weeks' time, have a very blessed 2 weeks to come, and a good night in advance. God bless.
Good night. All right, God bless.
Wild Remit helped me give you the best start in life. Even if I couldn't be there to see it. I know it wasn't easy comparing yourself to your friends, but the money I sent home meant that you could be right there alongside them today. I'm so proud to be your mother, almost as proud as you must be now that you're starting an incredible new chapter.